1. What is the priority nursing action for a patient with COPD experiencing an acute exacerbation? A. Encourage fluid intake. B. Administer oxygen at 2 liters per minute via duct nasal cannula. C. Place the patient in the supine position. D. Administer a sedative to reduce anxiety. Answer. B. Administer oxygen at 2 liters per minute via duct nasal cannula. Rationale. Administering low-flow oxygen is the priority to correct hypoxemia. High levels can depress respiratory drive. A is supportive but not priority. C can worsen dyspnea. D is unsafe. Sedatives may depress respiration. 2. Which is a common early symptom of COPD? A. Chest pain. B. Productive cough. C. Clubbing of fingers. D. Cyanosis. Answer. B. Productive cough. Rationale. A chronic productive cough is a hallmark early sign of COPD. Chest pain and cyanosis occur later. Clubbing may develop over time, not early. 3. A nurse is teaching a COPD patient about pursed lip breathing. What is the purpose of this technique? A. Increase oxygen intake. B. Improve appetite. C. Promote relaxation. D. Prevent airway collapse. Answer. D. Prevent airway collapse. Rationale. Pursed lip breathing helps keep airways open during exhalation by creating back pressure. A is a common misconception. C is secondary. B is unrelated. 4. Which of the following is a modifiable risk factor for developing COPD? A. Genetic predisposition.
B. Smoking.
C. Age. D. Family history. Answer. B. Smoking. Rationale. Smoking is the leading modifiable risk factor. The others are non-modifiable. 5. The nurse should include which instruction when educating a patient with COPD about nutrition? A. Eat large meals. B. Drink fluids with meals. C. Consume a high-protein, high-calorie diet. D. Avoid snacks between meals. Answer. C. Consume a high-protein, high-calorie diet. Rationale. COPD increases energy demands. A high-calorie, high-protein diet helps maintain energy. A may cause fatigue. B can cause bloating. D limits intake. 6. Which medication class is commonly used for long-term control in COPD? A. Antihistamines. B. Beta blockers. C. Inhaled corticosteroids. D. Opioids. Answer. C. Inhaled corticosteroids. Rationale. Inhaled corticosteroids reduce inflammation. Antihistamines are not routine. Beta blockers are used cautiously. Opioids are not for routine COPD management. 7. The nurse notes that a COPD patient has an SpO2 of 89%. What is the best nursing response? A. Increase oxygen to 6 liters per minute. B. Notify the provider immediately. C. Document the finding and continue to monitor. D. Place the patient in Trendelenburg position. Answer. C. Document the finding and continue to monitor. Rationale. COPD patients may tolerate lower SpO2 levels. 88 to 92% is often acceptable. A is too high. B may be premature. D is inappropriate for respiratory distress. 8. A patient with COPD is prescribed ipratropium bromide. What is the purpose of this medication? A. Reduce inflammation. B. Stimulate respiratory drive.
C. Dilate the bronchi.
D. Increase sputum production. Answer. C. Dilate the bronchi. Rationale. Ipratropium is an anticholinergic bronchodilator. A is for corticosteroids. B is not accurate. D is not a goal of treatment. 9. What is a typical ABG finding in a patient with COPD? A. pH 7.50, PaCO2 30 mm of mercury. B. pH 7.35, PaCO2 50 mm of mercury. C. pH 7.45, PaCO2 35 mm of mercury. D. pH 7.60, PaCO2 25 mm of mercury. Answer. B. pH 7.35, PaCO2 50 mm of mercury. Rationale. COPD patients often have compensated respiratory acidosis, normal pH with elevated CO2. Others show alkalosis. 10. Which intervention can help reduce the risk of COPD exacerbation? A. Avoiding spicy foods. B. Yearly influenza vaccination. C. Restricting physical activity. D. Increasing dairy intake. Answer: B. Yearly influenza vaccination. Rationale: vaccines prevent respiratory infections that can trigger exacerbations. A, C, and D are not evidence-based strategies. 11. During discharge teaching, which statement indicates that the patient understands COPD self-management? A. I should only use my inhaler when I feel short of breath. B. I will avoid physical activity to conserve energy. C. I'll attend pulmonary rehab to improve my breathing. D. I'll stay indoors all the time to avoid getting sick. Answer: C. I'll attend pulmonary rehab to improve my breathing. Rationale: pulmonary rehab is beneficial for COPD patients. A is incorrect. Maintenance meds are important. B reduces conditioning. D promotes isolation. 12. Which finding should the nurse report immediately in a COPD patient? A. Barrel chest. B. Clubbed fingers. C. Confusion. D. Chronic cough. Answer: C. Confusion. Rationale: confusion can indicate hypoxia or CO2 retention. The others are chronic and expected findings. 13. Which positioning helps improve breathing in a COPD patient? A. Supine with pillows. B. Prone position. C. Tripod position. D. Lateral recumbent. Answer: C. Tripod position. Rationale: tripod position enhances lung expansion and diaphragmatic movement. A, B, D restrict ventilation. 14. Which instruction should be included when teaching about metered dose inhaler, MDI use? A. Inhale quickly after pressing the canister. B. Wait 5 minutes between puffs. C. Shake the inhaler before each use. D. Exhale forcefully into the inhaler. Answer: C. Shake the inhaler before each use. Rationale: shaking mixes medication properly. Inhale slowly, not quickly. 1 minute wait is enough. Never exhale into inhaler. 15. A nurse is caring for a COPD patient with fatigue and dyspnea. What should the nurse recommend? A. Complete all tasks in the morning. B. Use energy-conserving techniques. C. Limit rest periods during the day. D. Avoid using assistive devices. Answer: B. Use energy-conserving techniques. Rationale: techniques like sitting while bathing help reduce fatigue. A may cause exhaustion. C. Reduces recovery. D is inappropriate. 16. Which lab finding is expected in a COPD patient? A. Low hematocrit. B. Elevated hemoglobin. C. Hypokalemia. D. Low white blood cell count. Answer: B. Elevated hemoglobin. Rationale: chronic hypoxia can trigger increased red blood cell production. A, C, and D are not expected in COPD. 17. Why is smoking cessation critical in COPD management? A. It reverses airway damage. B. It prevents oxygen dependence. C. It slows disease progression. D. It reduces appetite. Answer: C. It slows disease progression. Rationale: smoking cessation doesn't reverse damage, but slows worsening. A is false. B is not always true. D is irrelevant. 18. Which ethical consideration is most relevant in end-stage COPD care? A. Encouraging daily exercise. B. Supporting advance directives. C. Avoiding palliative care. D. Withholding medication. Answer: B. Supporting advance directives. Rationale: patients with terminal COPD should be encouraged to express wishes through directives. A is unrealistic. C and D are unethical unless based on directives. 19. What should the nurse do first when a COPD patient becomes increasingly drowsy and difficult to arouse? A. Suction the airway. B. Stop oxygen immediately. C. check oxygen saturation and notify the provider. D. Stimulate the patient to wake up. Answer: C. Check oxygen saturation and notify the provider. Rationale: drowsiness may indicate CO2 retention. Assess oxygenation and notify the provider urgently. A, B, and D may delay critical action. 20. A COPD patient complains of increased sputum production and worsening cough. What is the nurse's best action? A. Administer a cough suppressant. B. Increase corticosteroid dose independently. C. Notify the provider of possible exacerbation. D. Advise rest without intervention. Answer: C. Notify the provider of possible exacerbation. Rationale: these are signs of exacerbation. Early provider intervention is key. A and B are inappropriate without orders.
D delays care.
21. A nurse is assessing a patient with COPD. Which finding suggests chronic hypoxemia? A. Clubbing of the fingers. B. Wheezing on expiration. C. Sputum production.
D. Tachypnea at rest.
Answer: A. Clubbing of the fingers. Rationale: clubbing of the fingers is a sign of chronic hypoxemia, often seen in long-standing COPD due to prolonged low oxygen levels affecting nail bed growth. Option B, wheezing, indicates airway obstruction but is not specific to chronic hypoxemia. Option C, sputum production, is common in COPD but not directly linked to hypoxemia. Option D, tachypnea, may occur during exertion or exacerbations but is less specific to chronic low oxygen states than clubbing. 22. A patient with COPD is prescribed tiotropium. What should the nurse teach the patient about this medication? A. Use it as a rescue inhaler during dyspnea. B. Take it once daily to prevent symptoms. C. Rinse the mouth after each use. D. Expect immediate relief after inhalation. Answer: B. Take it once daily to prevent symptoms. Rationale: tiotropium is a long-acting anticholinergic bronchodilator used daily to prevent COPD symptoms, not for acute relief. Option A is incorrect as tiotropium is not a rescue inhaler, e.g., albuterol is. Option C applies to inhaled corticosteroids, not tiotropium, which does not cause oral thrush. Option D is incorrect because tiotropium's effects build over time, not immediately. 23. The nurse is caring for a patient with COPD who reports difficulty sleeping. What is the most likely cause? A. Nocturnal oxygen desaturation. B. Side effects of beta blockers. C. Excessive caffeine intake.
D. Anxiety about hospitalization.
Answer: A. Nocturnal oxygen desaturation. Rationale: nocturnal oxygen desaturation is common in COPD due to hypoventilation during sleep, leading to disrupted sleep patterns. Option B is unlikely unless the patient is on beta blockers, which are not directly linked to COPD-related sleep issues. Option C may contribute but is less likely than hypoxemia. Option D is possible but less specific, as sleep disturbances in COPD are often physiologically driven. 24. Which dietary recommendation is most appropriate for a patient with COPD? A. High-carbohydrate diet to boost energy. B. Small, frequent meals to reduce dyspnea. C. Low-protein diet to ease digestion. D. Fluid restriction to prevent edema. Answer: B. Small, frequent meals to reduce dyspnea. Rationale: small, frequent meals reduce gastric distension, which can compress the diaphragm and worsen dyspnea in COPD patients. Option A is incorrect as high-carbohydrate diets may increase CO2 production, straining respiration. Option C is incorrect because adequate protein supports respiratory muscle strength. Option D is inappropriate as hydration helps thin mucus unless contraindicated by other conditions. 25. A patient with COPD is experiencing an exacerbation. Which medication should the nurse anticipate administering first? A. Oral prednisone. B. Inhaled albuterol. C. Intravenous antibiotics. D. Long-acting tiotropium. Answer: B. Inhaled albuterol. Rationale: inhaled albuterol, a short-acting bronchodilator, is the first-line treatment for acute COPD exacerbations to rapidly relieve bronchospasm and improve airflow. Option A, prednisone, is used for inflammation but acts slower. Option C, antibiotics, is given if infection is confirmed, not immediately. Option D, tiotropium, is for maintenance, not acute relief. 26. The nurse is teaching a patient with COPD about smoking cessation. Which statement by the patient indicates understanding? A. I'll switch to e-cigarettes to avoid nicotine. B. Quitting smoking can slow my lung damage. C. I only need to cut back on cigarettes. D. Smoking doesn't affect my COPD anymore. Answer. B. Quitting smoking can slow my lung damage. Rationale. Smoking cessation is critical in COPD to slow disease progression and preserve lung function. Option A is incorrect as e-cigarettes still deliver harmful substances. Option C is incorrect because reducing smoking is less effective than quitting entirely. Option D is incorrect as smoking continues to worsen COPD at all stages. 27. A patient with COPD has a PaO2 of 55 millimeters of mercury. What is the nurse's priority action? A. Administer oxygen at 6 liters per minute. B. Encourage coughing and deep breathing. C. Notify the healthcare provider. D. Place the patient in a supine position. Answer. C. Notify the healthcare provider. Rationale. A PaO2 of 55 millimeters of mercury indicates severe hypoxemia, requiring medical evaluation to adjust oxygen therapy or other interventions safely, as COPD patients are sensitive to high oxygen levels that may suppress respiratory drive. Option A is incorrect without a prescription, as high-flow oxygen may cause CO2 retention. Option B does not address hypoxemia directly. Option D may worsen breathing by limiting lung expansion. 28. Which assessment finding in a patient with COPD indicates effective oxygen therapy? A. Oxygen saturation of 99%. B. Respiratory rate of 16 breaths per minute. C. Cyanosis of the lips. D. Confusion and agitation. Answer. B. Respiratory rate of 16 breaths per minute. Rationale. A respiratory rate of 16 breaths per minute, normal range, suggests improved oxygenation and reduced respiratory effort, indicating effective therapy. Option A, 99% saturation, is above the COPD target, 88 to 92%, risking CO2 retention. Option C indicates hypoxemia, suggesting ineffective therapy. Option D suggests hypoxemia or hypercapnia, not effective treatment. 29. The nurse is planning care for a patient with COPD. Which intervention best promotes airway clearance? A. Administering a diuretic. B. Teaching huff coughing. C. Limiting physical activity. D. Reducing oxygen flow rate. Answer. B. Teaching huff coughing. Rationale. Huff coughing is a technique that helps COPD patients clear mucus from airways without excessive effort, promoting airway patency. Option A, diuretic, addresses fluid overload, not mucus. Option C may worsen deconditioning, not aiding clearance. Option D could exacerbate hypoxemia, unrelated to mucus clearance. 30. A patient with COPD asks why they feel tired all the time. What is the nurse's best response? A. Fatigue is due to low oxygen levels in your blood. B. You're probably not eating enough calories. C. Tiredness is a side effect of your medications. D. You need to exercise more to build energy. Answer. A. Fatigue is due to low oxygen levels in your blood. Rationale. Fatigue in COPD is primarily due to chronic hypoxemia and the increased work of breathing, reducing energy availability. Option B may contribute, but is less likely without nutritional assessment. Option C is incorrect unless specific medications, e.g., sedatives, are identified. Option D is impractical as excessive exercise may worsen fatigue without proper pacing. 31. A patient with COPD is prescribed a combination inhaler with budesonide and formoterol. What should the nurse monitor for? A. Oral candidiasis. B. Hypoglycemia. C. Bradycardia. D. Hyperkalemia. Answer. A. Oral candidiasis. Rationale: budesonide, an inhaled corticosteroid, can cause oral candidiasis, thrush, requiring monitoring and teaching about mouth rinsing. Option B, hypoglycemia, is unrelated to these medications. Option C, bradycardia, is not a common side effect of formoterol, a long-acting beta agonist. Option D, hyperkalemia, is not associated with this combination. 32. The nurse is caring for a patient with COPD during pulmonary rehabilitation. Which activity is most appropriate? A. High-intensity interval training. B. Supervised walking with rest breaks. C. Lifting heavy weights. D. Swimming in cold water. Answer: B. Supervised walking with rest breaks. Rationale: supervised walking with rest breaks is safe and effective for improving endurance in COPD patients, tailored to their respiratory capacity. Option A is too intense and may cause dyspnea. Option C risks overexertion and respiratory distress. Option D is inappropriate due to cold water potentially triggering bronchospasm. 33. A patient with COPD reports weight loss. What is the most likely cause? A. Increased metabolic demand from breathing. B. Side effects of bronchodilators. C. Reduced appetite from antibiotics. D. Fluid loss from diuretics. Answer: A. Increased metabolic demand from breathing. Rationale: the increased work of breathing in COPD raises metabolic demand, burning more calories and leading to weight loss, especially in advanced disease. Option B is incorrect, as bronchodilators rarely cause weight loss. Option C is unlikely unless antibiotics are causing nausea, which is less common. Option D applies only if diuretics are prescribed, not a primary COPD issue. 34. Which statement by a patient with COPD indicates a need for further teaching about exacerbation prevention? A. I'll get my flu shot every year. B. I'll keep smoking but use a filter. C. I'll avoid crowded places during cold season. D. I'll use my inhaler as prescribed. Answer: B. I'll keep smoking but use a filter. Rationale: smoking, even with a filter, worsens COPD and increases exacerbation risk, indicating a misunderstanding. Options A, C, and D reflect correct prevention strategies. Annual flu shots reduce infection risk. Avoiding crowds limits exposure to viruses, and proper inhaler use controls symptoms. 35. The nurse is assessing a patient with COPD for signs of COR pulmonale. Which finding is most indicative? A. Peripheral edema. B. Barrel chest. C. Dry cough. D. Wheezing. Answer: A. Peripheral edema. Rationale: COR pulmonale, right heart failure due to lung disease, causes peripheral edema from increased venous pressure. Option B, barrel chest, is a chronic COPD sign, not specific to COR pulmonale. Option C, dry cough, is less common in COPD and unrelated. Option D, wheezing, indicates airway obstruction, not heart failure. 36. A patient with advanced COPD discusses advanced directives. What is the nurse's best response? A. You don't need to worry about that now. B. Let's discuss your preferences for care. C. That's only for patients in hospice. D. Your doctor will decide what's best. Answer: B. Let's discuss your preferences for care. Rationale: discussing advanced directives respects the patient's autonomy and ensures their wishes are documented, especially in advanced COPD with high mortality risk. Option A dismisses the patient's concern. Option C is incorrect, as directives apply to any serious illness. Option D undermines patient-centered care. 37. The nurse is teaching a patient with COPD about home oxygen safety. Which instruction is most important? A. Store oxygen tanks near a heater. B. Avoid smoking near oxygen equipment. C. Use oxygen only during activity. D. Keep tanks in direct sunlight. Answer: B. Avoid smoking near oxygen equipment. Rationale: smoking near oxygen is a fire hazard due to oxygen's flammability, making this the priority safety instruction. Option A is incorrect, as heat sources pose a risk. Option C is incorrect, as oxygen use depends on prescription, not just activity. Option D is incorrect as sunlight may affect tank integrity. 38. A patient with COPD has a new prescription for roflumilast. What should the nurse monitor for? A. Weight loss. B. Hypertension. C. Hypokalemia. D. Skin rash. Answer: A. Weight loss. Rationale: roflumilast, a phosphodiesterase, inhibitor for severe COPD, commonly causes weight loss, requiring monitoring. Option B. Hypertension is not a primary side effect. Option C. Hypokalemia is unrelated. Option D. Skin rash is less common than gastrointestinal or weight-related effects. 39. Which position is most effective for a patient with COPD experiencing acute dyspnea? A. Supine with legs elevated. B. Sitting upright with arms supported. C. Lying on the left side. D. Prone with head elevated. Answer: B. Sitting upright with arms supported. Rationale: sitting upright with arms supported, tripod position, maximizes lung expansion and reduces accessory muscle use, easing dyspnea. Option A restricts diaphragm movement. Option C limits chest expansion. Option D is impractical and may worsen breathing. 40. The nurse is evaluating a patient with COPD after teaching about medication adherence. Which action indicates understanding? A. Skipping doses when feeling better. B. Using a spacer with the inhaler. C. Taking extra doses during dyspnea. D. Storing inhalers in the bathroom. Answer: B. Using a spacer with the inhaler. Rationale: using a spacer improves medication delivery to the lungs, enhancing effectiveness and indicating adherence to proper technique. Option A risks symptom recurrence. Option C may lead to overdose. Option D is incorrect as humidity can degrade inhalers. 41. A nurse is assessing a patient with COPD. Which finding indicates a potential infection triggering an exacerbation? A. Clear sputum production. B. Yellow-green sputum production. C. Oxygen saturation of 90%. D. Respiratory rate of 18 breaths per minute. Answer: B. Yellow-green sputum production. Rationale: yellow-green sputum suggests a bacterial infection, a common trigger for COPD exacerbations. Option A, clear sputum, is typical in stable COPD and less indicative of infection. Option C, 90% saturation, is within the target range for COPD and not specific to infection. Option D, respiratory rate of 18, is normal and not necessarily indicative of infection. 42. A patient with COPD is prescribed supplemental oxygen at 2 liters per minute. What is the nurse's priority assessment? A. Blood pressure changes. B. Respiratory rate and pattern. C. Skin color and temperature. D. Urine output. Answer: B. Respiratory rate and pattern. Rationale: monitoring respiratory rate and pattern is the priority to assess for oxygen effectiveness and detect CO2 retention, which can occur in COPD patients with excessive oxygen. Option A, blood pressure, is less directly related. Option C, skin color, is secondary to respiratory status. Option D, urine output, is unrelated to immediate oxygen therapy effects. 43. The nurse is teaching a patient with COPD about diaphragmatic breathing. What is the primary benefit of this technique? A. Increases mucus clearance. B. Improves oxygen saturation. C. Reduces work of breathing. D. Prevents lung infections. Answer: C. Reduces work of breathing. Rationale: diaphragmatic breathing strengthens the diaphragm, improving efficiency and reducing the energy required for breathing in COPD patients. Option A is incorrect as mucus clearance relies more on coughing techniques. Option B may occur indirectly, but is not the primary goal. Option D is unrelated, as breathing exercises don't directly prevent infections. 44. A patient with COPD reports feeling anxious during dyspnea episodes. What is the nurse's best intervention? A. Administer a sedative immediately. B. Teach relaxation techniques. C. Increase oxygen flow to 6 liters per minute. D. Encourage rapid breathing exercises. Answer: B. Teach relaxation techniques. Rationale. Relaxation techniques, such as guided imagery or slow breathing, help reduce anxiety, which can worsen dyspnea. Option A, sedative, risks respiratory depression and requires a prescription. Option C is unsafe without medical orders, as high oxygen may cause CO2 retention. Option D may increase dyspnea and anxiety. 45. Which laboratory results should the nurse report immediately for a patient with COPD? A. PaCO2 of 65 millimeters of mercury. B. Hemoglobin of 13G/dl. C. Potassium of 4.0 milliequivalent/L. D. Glucose of 100 milligrams per deciliter. Answer. A. PaCO2 of 65 millimeters of mercury. Rationale. A PaCO2 of 65 millimeters of mercury indicates hypercapnia, a sign of worsening respiratory failure in COPD, requiring urgent intervention. Option B, hemoglobin is normal. Option C, potassium is normal. Option D, glucose, is normal and not immediately concerning. 46. The nurse is planning care for a patient with COPD. Which goal is most appropriate for nutritional status? A. Gain 10 pounds in 1 month. B. Maintain stable body weight. C. Reduce calorie intake by 500 daily. D. Eliminate all dietary fats. Answer. B. Maintain stable body weight. Rationale. Maintaining stable body weight is realistic for COPD patients, as weight loss from increased metabolic demand is common, and obesity can worsen dyspnea. Option A is unrealistic and may strain breathing. Option C risks malnutrition. Option D is unnecessary and may reduce energy availability. 47. A patient with COPD is prescribed ipratropium. What should the nurse include in patient teaching? A. Use it every 4 hours for acute dyspnea. B. Take it regularly to prevent bronchospasm. C. Expect a dry cough as a side effect. D. Stop using it if heart rate increases. Answer. B. Take it regularly to prevent bronchospasm. Rationale. Ipratropium, a short-acting anticholinergic, is used regularly, e.g., every 6 hours, to prevent bronchospasm, not as a rescue inhaler. Option A is incorrect as albuterol is used for acute dyspnea. Option C is incorrect. Dry mouth, not cough, is a common side effect. Option D is incorrect unless severe tachycardia occurs, which requires medical evaluation. 48. Which environmental factor should the nurse advise a patient with COPD to avoid? A. High humidity. B. Air conditioning. C. Dust and pet dander. D. Bright lighting. Answer. C. Dust and pet dander. Rationale. Dust and pet dander are irritants that can trigger bronchospasm and exacerbate COPD symptoms. Option A, high humidity, may help thin mucus. Option B, air conditioning, can reduce allergens if filtered. Option D, bright lighting, is unrelated to COPD. 49. A patient with COPD is receiving non-invasive positive pressure ventilation, NIPPV. What is the nurse's priority action? A. Check the mask fit for leaks. B. Increase sedation to ensure compliance. C. Reduce oxygen concentration. D. Encourage frequent eating. Answer. A. Check the mask fit for leaks. Rationale. A proper mask fit prevents leaks, ensuring effective ventilation and oxygenation in NIPPV. Option B is incorrect as sedation is avoided to maintain respiratory drive. Option C is unsafe without medical orders. Option D is impractical during NIPPV and risks aspiration. 50. The nurse is educating a patient with COPD about exercise. Which statement indicates understanding? A. I'll jog daily to improve my lungs. B. I'll stop exercising if I feel tired. C. I'll start with short walks and rest as needed. D. I don't need exercise since I use oxygen. Answer. C. I'll start with short walks and rest as needed. Rationale. Short walks with rest periods are safe and effective for building endurance in COPD without causing excessive dyspnea. Option A, jogging, is too intense. Option B may limit benefits if stopping prematurely. Option D is incorrect as exercise improves respiratory muscle strength, complementing oxygen therapy. 51. A patient with COPD has a new prescription for theophylline. What should the nurse monitor? A. Serum drug levels. B. Blood glucose levels. C. Urine output. D. Skin integrity. Answer: A. Serum drug levels. Rationale: theophylline has a narrow therapeutic range, requiring monitoring of serum levels to prevent toxicity, e.g., nausea, seizures. Option B, glucose, is unrelated. Option C, urine output, is not directly affected. Option D, skin integrity, is not a primary concern with theophylline. 52. The nurse observes a patient with COPD using an inhaler incorrectly. What is the most common error? A. Holding breath too long after inhalation. B. Not shaking the inhaler before use. C. Inhaling too slowly and deeply. D. Rinsing the mouth before use. Answer: B. Not shaking the inhaler before use. Rationale: failing to shake the inhaler for meter-dose inhalers prevents proper mixing of medication, reducing effectiveness. Option A is incorrect as holding breath briefly is correct. Option C is incorrect as slow, deep inhalation is proper technique. Option D is incorrect as rinsing applies post-use for corticosteroids. 53. A patient with COPD reports chest tightness. What is the nurse's first action? A. Administer a loop diuretic. B. Assess respiratory status. C. Elevate the head of the bed. D. Provide a high-calorie snack. Answer: B. Assess respiratory status. Rationale: chest tightness may indicate bronchospasm or exacerbation, requiring immediate respiratory assessment, e.g., breath sounds, oxygen saturation. Option A, diuretic, is irrelevant unless heart failure is confirmed. Option C may help but is secondary to assessment. Option D is unrelated to acute symptoms. 54. Which instruction should the nurse give a patient with COPD to prevent respiratory infections? A. Avoid handwashing to maintain skin oils. B. Get a pneumococcal vaccine. C. Limit contact with family members. D. Use a humidifier only in summer. Answer: B. Get a pneumococcal vaccine. Rationale: the pneumococcal vaccine reduces the risk of pneumonia, a common cause of COPD exacerbations. Option A is incorrect as handwashing prevents infections. Option C is impractical and unnecessary. Option D is incorrect as humidifiers can help year-round to thin mucus. 55. A patient with COPD is hypoxic despite oxygen therapy. What should the nurse suspect? A. Inadequate oxygen flow rate. B. Normal response to COPD. C. Allergic reaction to oxygen. D. Anxiety causing hyperventilation. Answer: A. Inadequate oxygen flow rate. Rationale: persistent hypoxia suggests the oxygen flow rate may be too low to meet the patient's needs, requiring adjustment. Option B is incorrect as hypoxia should improve with proper therapy. Option C is not a recognized condition. Option D is unlikely as hyperventilation typically lowers CO2, not oxygen. 56. The nurse is discussing end-of-life care with a patient with advanced COPD. Which statement reflects a palliative care goal? A. Cure the disease with aggressive treatment. B. Maximize comfort and symptom control. C. Focus only on life-prolonging measures. D. Avoid all medications to simplify care. Answer: B. Maximize comfort and symptom control. Rationale: palliative care in advanced COPD prioritizes symptom relief, e.g., dyspnea, anxiety, and quality of life, not cure. Option A is unrealistic as COPD is incurable. Option C opposes palliative principles. Option D is incorrect as medications are used to manage symptoms. 57. A patient with COPD asks about using a nebulizer. What is the nurse's best response? A. Nebulizers are only for hospital use. B. They deliver medication as a mist for easier inhalation. C. They replace all other inhalers permanently. D. They're less effective than meter-dose inhalers. Answer: B. They deliver medication as a mist for easier inhalation. Rationale: nebulizers convert medication into a mist, aiding patients who struggle with inhaler coordination. Option A is incorrect as nebulizers are used at home. Option C is incorrect as they complement, not replace, other devices. Option D is incorrect. Nebulizers are equally effective for some patients. 58. Which finding in a patient with COPD suggests dehydration? A. Moist mucous membranes. B. Increased urine output. C. Dry skin and poor turgor. D. Weight gain of 2 pounds. Answer: C. Dry skin and poor turgor. Rationale: dry skin and poor turgor indicate dehydration, which can thicken mucus and worsen COPD symptoms. Option A, moist membranes, suggests hydration. Option B, increased urine output, is normal or indicates overhydration. Option D, weight gain, may suggest fluid retention, not dehydration. 59. The nurse is caring for a patient with COPD during an exacerbation. Which intervention should be implemented first? A. Start intravenous fluids. B. Administer a short-acting bronchodilator. C. Order a chest X-ray. D. Teach relaxation techniques. Answer: B. Administer a short-acting bronchodilator. Rationale: a short-acting bronchodilator, e.g., albuterol, is the first-line treatment to relieve acute bronchospasm during a COPD exacerbation. Option A, fluids, is supportive but not urgent. Option C, X-ray, is diagnostic, not immediate. Option D may help anxiety but doesn't address airway obstruction. 60. A patient with COPD says, "I don't want to be a burden." What is the nurse's best response? A. You're not a burden. Let's talk about your concerns. B. Everyone feels that way, don't worry. C. Focus on getting better instead. D. Your family can handle everything. Answer: A. You're not a burden. Let's talk about your concerns. Rationale: acknowledging the patient's feelings and encouraging discussion promotes emotional support and trust, aligning with patient-centered care. Option B dismisses the concern. Option C ignores emotional needs. Option D assumes family capacity and avoids addressing the patient's worry. 61. A nurse is assessing a patient with COPD. Which finding suggests an acute exacerbation? A. Stable oxygen saturation of 90%. B. New onset confusion. C. Chronic dry cough. D. Barrel chest appearance. Answer: B. New onset confusion. Rationale: new onset confusion in a COPD patient may indicate hypoxemia or hypercapnia, both signs of an acute exacerbation requiring urgent attention. Option A, 90% saturation, is within the COPD target range and not alarming. Option C, dry cough, is less specific, as productive cough is more typical in exacerbations. Option D, barrel chest, is a chronic finding, not acute. 62. A patient with COPD is prescribed salmeterol. What should the nurse teach the patient about this medication? A. Use it for immediate relief of dyspnea. B. Take it twice daily for long-term control. C. Expect weight gain as a side effect. D. Stop using it if a rash develops. Answer: B. Take it twice daily for long-term control. Rationale: salmeterol, a long-acting beta agonist, is used twice daily to prevent symptoms, not for acute relief. Option A is incorrect as short-acting bronchodilators, e.g., albuterol, are used for immediate dyspnea. Option C is incorrect as weight gain is not a common side effect. Option D is incorrect unless the rash is severe, which requires medical consultation, not abrupt cessation. 63. The nurse is caring for a patient with COPD who reports difficulty clearing mucus. What is the best intervention? A. Encourage fluid restriction. B. Teach controlled coughing techniques. C. Administer a sedative to reduce effort. D. Decrease oxygen flow rate. Answer: B. Teach controlled coughing techniques. Rationale: Controlled coughing, such as huff coughing, helps mobilize and clear mucus effectively in COPD patients. Option A is incorrect as hydration thins mucus, aiding clearance. Option C is dangerous, as sedatives may suppress respiratory drive. Option D is irrelevant and may worsen hypoxemia. 64. A patient with COPD asks why they need a flu vaccine annually. What is the nurse's best response? A. It prevents all respiratory infections. B. It reduces the risk of flu-related exacerbations. C. It eliminates the need for antibiotics. D. It improves your lung capacity. Answer. B. It reduces the risk of flu-related exacerbations. Rationale. The flu vaccine lowers the risk of influenza, a common trigger for COPD exacerbations, by boosting immunity. Option A is incorrect as it doesn't prevent all infections. Option C is incorrect as vaccines don't replace antibiotics. Option D is incorrect as vaccines don't affect lung function directly. 65. Which finding in a patient with COPD indicates effective use of pursed lip breathing? A. Increased respiratory rate. B. Decreased dyspnea during activity. C. Louder wheezing on expiration. D. Reduced sputum production. Answer. B. Decreased dyspnea during activity. Rationale. Pursed lip breathing reduces dyspnea by maintaining airway pressure, improving exhalation, and easing breathing effort during activity. Option A, increased respiratory rate, suggests distress, not effectiveness. Option C, louder wheezing, indicates obstruction, not improvement. Option D is unrelated, as pursed lip breathing doesn't affect sputum volume. 66. The nurse is planning care for a patient with COPD. Which intervention best supports energy conservation? A. Schedule all tasks in the morning. B. Use a walker for ambulation. C. Avoid all physical activity. D. Eat large meals to boost energy. Answer. B. Use a walker for ambulation. Rationale. A walker reduces energy expenditure during ambulation, supporting mobility while conserving energy in COPD patients. Option A may lead to fatigue. Option C promotes deconditioning, worsening symptoms. Option D, large meals, can cause gastric distension, increasing dyspnea. 67. A patient with COPD is prescribed a corticosteroid inhaler. What should the nurse teach to prevent complications? A. Use it before other inhalers. B. Rinse the mouth after use. C. Take it only during exacerbations. D. Store it in a warm place. Answer. B. Rinse the mouth after use. Rationale. Rinsing the mouth after using a corticosteroid inhaler prevents oral candidiasis, a common side effect. Option A is incorrect as bronchodilators are typically used first to open airways. Option C is incorrect as corticosteroids are for maintenance, not just exacerbations. Option D is incorrect as inhalers should be stored at room temperature. 68. A patient with COPD reports feeling depressed about their condition. What is the nurse's best response? A. Focus on what you can still do. B. Depression is normal, it will pass. C. Let's discuss how you're feeling. D. You should avoid thinking about it. Answer. C. Let's discuss how you're feeling. Rationale. Encouraging the patient to express feelings fosters emotional support and identifies needs for further intervention, such as counseling. Option A dismisses the patient's emotions. Option B minimizes the issue, ignoring potential clinical depression. Option D avoids addressing the patient's concern. 69. The nurse is assessing a patient with COPD for signs of right-sided heart failure. Which finding is most concerning? A. Jugular vein distension. B. Clear lung sounds. C. Heart rate of 80 beats per minute. D. Dry mucous membranes. Answer. A. Jugular vein distension. Rationale. Jugular vein distension indicates increased venous pressure, a sign of right-sided heart failure, cor pulmonale, due to chronic lung disease and COPD. Option B is normal and not concerning. Option C is within normal limits. Option D suggests dehydration, not heart failure. 70. A patient with COPD is receiving oxygen at 2 liters per minute via duct nasal cannula. What should the nurse do to ensure safety? A. Place a no smoking sign near the patient. B. Increase the flow rate during sleep. C. Remove the cannula during meals. D. Use a humidifier only at night. Answer. A. Place a no smoking sign near the patient. Rationale. Oxygen is highly flammable, and a no smoking sign prevents fire hazards from smoking near oxygen equipment. Option B is incorrect as flow rates require medical orders. Option C risks hypoxemia. Option D is incorrect as humidifiers may be used continuously to prevent nasal dryness. 71. Which activity should the nurse encourage for a patient with COPD to improve respiratory muscle strength? A. Lifting heavy weights daily. B. Pursed lip breathing exercises. C. Running short distances. D. Holding breath for 20 seconds. Answer. B. Pursed lip breathing exercises. Rationale. Pursed lip breathing strengthens respiratory muscles by improving exhalation efficiency and reducing air trapping. Option A is too strenuous and risks dyspnea. Option C is inappropriate due to high oxygen demand. Option D is incorrect as breath holding may cause discomfort and isn't therapeutic. 72. A patient with COPD asks about the purpose of pulmonary function tests. What is the nurse's best response? A. They measure your heart function. B. They assess how well your lungs work. C. They check for lung infections. D. They predict your life expectancy. Answer. B. They assess how well your lungs work. Rationale. Pulmonary function tests, e.g., spirometry, measure lung capacity and airflow, assessing COPD severity and progression. Option A is incorrect as they don't evaluate heart function. Option C is incorrect as they don't detect infections. Option D is incorrect as they inform treatment, not prognosis directly. 73. The nurse is caring for a patient with COPD during an exacerbation. Which oxygen delivery method is most appropriate? A. Non-rebreather mask at 15 liters per minute. B. Nasal cannula at 2 liters per minute. C. Simple face mask at 10 liters per minute. D. Venturi mask at 4 liters per minute. Answer. D. Venturi mask at 4 liters per minute. Rationale. A Venturi mask delivers precise low-flow oxygen, ideal for COPD exacerbations to avoid CO2 retention while correcting hypoxemia. Option A delivers high oxygen, risking respiratory depression. Option B may be insufficient during an exacerbation. Option C provides less precise oxygen levels. 74. A patient with COPD reports increased fatigue. What should the nurse assess first? A. Oxygen saturation level. B. Blood pressure. C. Recent meal intake. D. Sleep schedule. Answer. A. Oxygen saturation level. Rationale. Fatigue in COPD is often due to hypoxemia, so assessing oxygen saturation is the priority to determine if low oxygen is the cause. Option B, blood pressure, is less directly related. Option C, meal intake, may contribute but is secondary. Option D, sleep, is relevant but not the first priority. 75. Which statement by a patient with COPD indicates understanding of infection prevention? A. I'll avoid my annual flu shot to save money. B. I'll wash my hands frequently. C. I'll stop using my inhaler during colds. D. I'll visit crowded places regularly. Answer. B. I'll wash my hands frequently. Rationale. Frequent hand washing reduces the risk of respiratory infections, a key prevention strategy for COPD patients. Option A is incorrect as flu shots are essential. Option C is incorrect as inhalers should continue unless advised otherwise. Option D increases infection risk. 76. The nurse is teaching a patient with COPD about home safety. Which instruction is most important? A. Keep floors clear of clutter to prevent falls. B. Use candles for ambience. C. Store oxygen tanks near the stove. D. Avoid using a humidifier. Answer. A. Keep floors clear of clutter to prevent falls. Rationale. Clearing floors prevents falls, critical for COPD patients with limited mobility and oxygen dependence. Option B is unsafe due to fire risk with oxygen. Option C is dangerous as oxygen tanks near heat sources pose a fire hazard. Option D is incorrect as humidifiers can aid mucus clearance. 77. A patient with advanced COPD expresses fear of dying during sleep. What is the nurse's best response? A. That's unlikely, so don't worry. B. Let's talk about what scares you. C. You'll feel better with more oxygen. D. Everyone feels this way at times. Answer. B. Let's talk about what scares you. Rationale. Exploring the patient's fears promotes emotional support and identifies needs for palliative care or counseling, respecting their concerns. Option A dismisses the fear. Option C assumes a physical cause, without assessment. Option D minimizes the patient's unique experience. 78. The nurse is evaluating a patient with COPD using a peak flow meter. What does this device measure? A. Oxygen saturation. B. Expiratory airflow rate. C. Carbon dioxide levels. D. Respiratory muscle strength. Answer. B. Expiratory airflow rate. Rationale. A peak flow meter measures peak expiratory flow rate, indicating airway obstruction severity in COPD. Option A is incorrect as pulse oximetry measures oxygen saturation. Option C is incorrect as CO2 requires blood gas analysis. Option D is incorrect as muscle strength isn't directly measured. 79. A patient with COPD is prescribed a mucolytic agent. What is the expected outcome? A. Reduced bronchospasm. B. Thinner mucus for easier clearance. C. Increased oxygen saturation. D. Decreased respiratory rate. Answer. B. Thinner mucus for easier clearance. Rationale. Mucolytics, e.g., acetylcysteine, thin mucus, aiding clearance in COPD patients with thick secretions. Option A is incorrect as bronchodilators reduce bronchospasm. Option C may occur indirectly, but isn't the primary effect. Option D is unrelated to mucolytics action. 80. The nurse is caring for a patient with COPD who is anxious about an upcoming surgery. What is the best intervention? A. Administer a sedative without consulting the provider. B. Teach slow, deep breathing techniques. C. Encourage the patient to avoid surgery. D. Increase oxygen flow to 5 liters per minute. Answer. B. Teach slow, deep breathing techniques. Rationale. Slow, deep breathing reduces anxiety and promotes relaxation without risking respiratory depression. Option A is unsafe and requires a prescription. Option C undermines medical advice. Option D is inappropriate without assessing oxygen needs, as high flow may harm COPD patients. 81. A nurse is assessing a patient with COPD. Which finding indicates possible CO2 retention? A. Oxygen saturation of 92%. B. Drowsiness and lethargy. C. Clear lung sounds. D. Heart rate of 76 beats per minute. Answer. B. Drowsiness and lethargy. Rationale. Drowsiness and lethargy suggest hypercapnia, CO2 retention, as elevated CO2 levels depress the central nervous system in COPD patients. Option A, 92% saturation, is within the target range and unrelated to CO2. Option C, clear lung sounds, is atypical in COPD and not specific to hypercapnia. Option D, heart rate of 76, is normal and not indicative of CO2 retention. 82. A patient with COPD is prescribed fluticasone. What should the nurse teach the patient to do after using this inhaler? A. Hold their breath for 5 seconds. B. Rinse their mouth with water. C. Exhale forcefully immediately. D. Take a second dose right away. Answer. B. Rinse their mouth with water. Rationale. Fluticasone, an inhaled corticosteroid, can cause oral candidiasis, so rinsing the mouth after use is essential. Option A is incorrect as holding breath for 10 seconds is standard, but 5 seconds is insufficient. Option C is incorrect as forceful exhalation expels medication. Option D is incorrect as dosing follows a prescribed schedule. 83. The nurse is caring for a patient with COPD who reports frequent nighttime awakenings. What is the most likely cause? A. High blood sugar levels. B. Nocturnal hypoxemia. C. Medication side effects. D. Excessive fluid intake. Answer: B. Nocturnal hypoxemia. Rationale: nocturnal hypoxemia, common in COPD due to hypoventilation during sleep, disrupts sleep and causes awakenings. Option A, high blood sugar, is unrelated unless diabetes is present. Option C may contribute, but is less likely without specific medications, e.g., theophylline. Option D is incorrect as fluid intake doesn't directly affect sleep in COPD. 84. Which instruction should the nurse give a patient with COPD to improve nutrition? A. Eat 3 large meals daily. B. Choose high-fat foods only. C. Rest before eating to reduce dyspnea. D. Avoid protein to ease digestion. Answer: C. Rest before eating to reduce dyspnea. Rationale: resting before meals conserves energy, reducing dyspnea and improving eating ability in COPD patients. Option A, large meals, may cause gastric distension, worsening breathing. Option B is incorrect as a balanced diet is needed, not just fats. Option D is incorrect as protein supports respiratory muscle strength. 85. A patient with COPD is experiencing an exacerbation. Which finding requires immediate intervention? A. Respiratory rate of 20 breaths per minute. B. Oxygen saturation of 85%. C. Sputum production of 2 tablespoons. D. Blood pressure of 130/80 mmHg. Answer: B. Oxygen saturation of 85%. Rationale: an oxygen saturation of 85% indicates severe hypoxemia requiring immediate intervention, e.g., oxygen adjustment, bronchodilators, to prevent respiratory failure. Option A, respiratory rate of 20, is mildly elevated but less urgent. Option C, sputum, is common in exacerbations but not critical. Option D, blood pressure, is normal. 86. The nurse is teaching a patient with COPD about smoking cessation. Which resource is most appropriate to recommend? A. A local gym membership. B. A smoking cessation support group. C. Over-the-counter herbal remedies. D. A high-protein diet plan. Answer: B. A smoking cessation support group. Rationale: a support group provides peer encouragement and strategies for quitting smoking, the most effective way to slow COPD progression. Option A, gym, supports fitness but not cessation directly. Option C is unreliable without evidence. Option D is unrelated to smoking. 87. A patient with COPD has a PaO2 of 60 millimeters of mercury. What should the nurse do first? A. Increase oxygen to 4 liters per minute. B. Notify the healthcare provider. C. Encourage deep breathing exercises. D. Administer a diuretic. Answer: B. Notify the healthcare provider. Rationale: a PaO2 of 60 millimeters of mercury indicates hypoxemia, requiring medical evaluation to adjust oxygen or other therapies safely, as COPD patients risk CO2 retention with high oxygen. Option A is incorrect without a prescription. Option C may not address severe hypoxemia. Option D is irrelevant to hypoxemia. 88. Which finding indicates a patient with COPD is tolerating oxygen therapy well? A. Cyanosis of the fingertips. B. Oxygen saturation of 90%. C. Increased confusion. D. Respiratory rate of 28 breaths per minute. Answer: B. Oxygen saturation of 90%. Rationale: an oxygen saturation of 90% is within the COPD target range, 88 to 92%, indicating effective therapy without CO2 retention risk. Option A, cyanosis, suggests hypoxemia. Option C, confusion, indicates possible hypercapnia or hypoxemia. Option D, tachypnea, suggests respiratory distress, not tolerance. 89. The nurse is planning care for a patient with COPD. Which intervention promotes effective airway clearance? A. Limiting fluid intake to 1 liter daily. B. Encouraging postural drainage. C. Administering a beta blocker. D. Reducing physical activity to rest. Answer. B. Encouraging postural drainage. Rationale. Postural drainage uses gravity to mobilize mucus, improving airway clearance in COPD patients with secretions. Option A thickens mucus, hindering clearance. Option C, beta blocker, may worsen bronchospasm. Option D promotes deconditioning, not clearance. 90. A patient with COPD asks why they feel short of breath even at rest. What is the nurse's best response? A. Your lungs are trapping air, making breathing harder. B. You're likely dehydrated and need more fluids. C. Your heart isn't pumping enough blood. D. Your medications are causing this feeling. Answer. A. Your lungs are trapping air, making breathing harder. Rationale. Air trapping from obstructed airways in COPD reduces effective ventilation, causing dyspnea even at rest. Option B, dehydration, is unrelated to resting dyspnea. Option C, heart failure, requires confirmation and isn't the primary cause. Option D is incorrect unless specific medications are known to cause dyspnea. 91. A patient with COPD is prescribed a combination inhaler with salmeterol and fluticasone. What should the nurse monitor for? A. Hyperglycemia. B. Oral thrush. C. Hypotension. D. Weight loss. Answer. B. Oral thrush. Rationale. Fluticasone, a corticosteroid, can cause oral thrush, requiring monitoring and teaching about mouth rinsing. Option A, hyperglycemia, is unrelated to inhaled medications. Option C, hypotension, is not a common side effect of salmeterol. Option D, weight loss, is less likely than with oral corticosteroids. 92. The nurse is assisting a patient with COPD in pulmonary rehabilitation. Which exercise is most appropriate? A. Sprinting for 30 seconds. B. Arm raises with light weights. C. Deep knee bends. D. Jumping jacks. Answer. B. Arm raises with light weights. Rationale. Arm raises with light weights build upper body strength safely, improving respiratory muscle endurance in COPD. Option A, sprinting, is too intense. Option C, knee bends, may strain breathing. Option D, jumping jacks, risks dyspnea due to high energy demand. 93. A patient with COPD reports unintentional weight loss. What should the nurse assess first? A. Daily calorie intake. B. Respiratory effort. C. Blood glucose levels. D. Fluid intake. Answer. B. Respiratory effort. Rationale. Increased respiratory effort in COPD raises metabolic demand, contributing to weight loss, so assessing breathing work is the priority. Option A, calorie intake, is secondary but relevant. Option C, glucose, is unrelated unless diabetes is suspected. Option D, fluids, is less directly linked to weight loss. 94. Which statement by a patient with COPD indicates a need for further teaching about exacerbation triggers? A. I'll avoid cold weather to protect my lungs. B. I'll keep using my wood-burning fireplace. C. I'll stay away from people with colds. D. I'll monitor my symptoms daily. Answer. B. I'll keep using my wood-burning fireplace. Rationale. Wood-burning fireplaces produce smoke, an irritant that can trigger COPD exacerbations, indicating a misunderstanding. Options A, C, and D are correct. Avoiding cold air, sick contacts, and monitoring symptoms help prevent exacerbations. 95. The nurse is assessing a patient with COPD for signs of polycythemia. Which finding is most indicative? A. Hemoglobin of 18G/DL. B. Heart rate of 88 beats per minute. C. Pale skin tone. D. Low blood pressure. Answer. A. Hemoglobin of 18G/DL. Rationale. Polycythemia, a compensatory response to chronic hypoxemia in COPD, elevates hemoglobin, e.g., 18G/dL to increase oxygen carrying capacity. Option B, heart rate is normal. Option C, pale skin, suggests anemia, not polycythemia. Option D, low blood pressure, is unrelated. 96. A patient with advanced COPD asks about hospice care. What is the nurse's best response? A. Hospice is only for cancer patients. B. It focuses on comfort when treatment goals change. C. It means stopping all your medications. D. You're not sick enough for hospice yet. Answer. B. It focuses on comfort when treatment goals change. Rationale. Hospice care prioritizes comfort and quality of life for patients with terminal illnesses like advanced COPD when curative treatment is no longer the goal. Option A is incorrect as hospice applies to many conditions. Option C is incorrect as medications continue for symptom relief. Option D assumes prognosis without assessment. 97. The nurse is teaching a patient with COPD about oxygen therapy at home. Which instruction is most critical? A. Use oxygen only during exercise. B. Secure oxygen tanks to prevent tipping. C. Store extra tanks in a closet. D. Turn off oxygen when not in use. Answer. B. Secure oxygen tanks to prevent tipping. Rationale. Securing oxygen tanks prevents them from falling, which could cause injury or damage, making it a critical safety measure. Option A is incorrect as oxygen use follows a prescription. Option C is acceptable but less urgent. Option D is incorrect as continuous use may be required. 98. A patient with COPD is prescribed roflumilast. What should the nurse teach the patient to report? A. Improved appetite. B. Mood changes or depression. C. Increased sputum production. D. Better exercise tolerance. Answer. B. Mood changes or depression. Rationale. Roflumilast can cause psychiatric side effects, such as mood changes or depression, which should be reported promptly. Option A, improved appetite, is not a concern. Option C, sputum, is expected in COPD and not specific to roflumilast. Option D, exercise tolerance, is a positive outcome, not a side effect. 99. Which position should the nurse recommend for a patient with COPD to ease breathing at rest? A. Lying flat with knees bent. B. Leaning forward with elbows on a table. C. Side lying with head elevated. D. Supine with arms at sides. Answer. B. Leaning forward with elbows on a table. Rationale. Leaning forward, tripod position, opens the chest and supports accessory muscles, easing breathing in COPD. Option A restricts lung expansion. Option C is less effective for dyspnea relief. Option D limits diaphragm movement, worsening breathing. 100. The nurse is evaluating a patient with COPD after teaching about medication use. Which action indicates understanding? A. Taking bronchodilators only when symptomatic. B. Using a spacer consistently with inhalers. C. Storing inhalers in a hot car. D. Skipping doses to save medication. Answer. B. Using a spacer consistently with inhalers. Rationale. A spacer improves medication delivery to the lungs, enhancing effectiveness and showing proper technique. Option A is incorrect as bronchodilators are often scheduled. Option C risks degrading medication. Option D leads to poor symptom control. 101. A nurse is assessing a patient with COPD. Which finding suggests worsening hypercapnia? A. Increased alertness. B. Tremors and irritability. C. Oxygen saturation of 89%. D. Respiratory rate of 16 breaths per minute. Answer. B. Tremors and irritability. Rationale. Tremors and irritability indicate hypercapnia, elevated CO2, as high CO2 levels affect the nervous system, causing neurological symptoms. Option A, increased alertness, suggests improved oxygenation, not hypercapnia. Option C, 89% saturation, is within COPD target range and unrelated to CO2. Option D, respiratory rate of 16, is normal and not specific to hypercapnia. 102. A patient with COPD is prescribed albuterol via nebulizer. What should the nurse monitor during administration? A. Blood glucose levels. B. Heart rate for tachycardia. C. Urine output. D. Skin turgor. Answer: B. Heart rate for tachycardia. Rationale: albuterol, a beta agonist, can cause tachycardia as a side effect, requiring heart rate monitoring. Option A, glucose, is unrelated to albuterol. Option C, urine output, is not affected. Option D, skin turgor, is irrelevant to nebulizer use. 103. The nurse is teaching a patient with COPD about managing dyspnea. Which technique is most effective? A. Rapid shallow breathing. B. Pursed lip breathing. C. Holding breath for 15 seconds. D. Coughing forcefully. Answer: B. Pursed lip breathing. Rationale: pursed lip breathing prolongs exhalation, reduces air trapping, and eases dyspnea in COPD patients. Option A, rapid breathing, worsens dyspnea. Option C, holding breath, is uncomfortable and ineffective. Option D, coughing, aids mucus clearance, but not dyspnea relief. 104. A patient with COPD asks how to prevent exacerbations during winter. What is the nurse's best response? A. Stay indoors with windows closed. B. Increase fluid intake to 4 liters daily. C. Avoid wearing scarves over the mouth. D. Stop using inhalers until spring. Answer: A. Stay indoors with windows closed. Rationale: staying indoors with windows closed reduces exposure to cold air and pollutants, common exacerbation triggers. Option B, excessive fluids, risks fluid overload. Option C is incorrect as scarves warm inhaled air, helping breathing. Option D is dangerous as inhalers are essential for symptom control. 105. A patient with COPD has a new onset of wheezing. What is the nurse's priority action? A. Administer a diuretic. B. Assess lung sounds and oxygen saturation. C. Encourage fluid restriction. D. Place the patient in a supine position. Answer: B. Assess lung sounds and oxygen saturation. Rationale: new wheezing suggests bronchospasm or exacerbation, so assessing lung sounds and oxygen saturation determines severity and guides intervention. Option A, diuretic, is irrelevant. Option C, fluid restriction, may thicken mucus. Option D worsens breathing by limiting lung expansion. 106. The nurse is planning care for a patient with COPD. Which goal is most appropriate for activity tolerance? A. Run 1 mile without stopping. B. Walk 100 feet with minimal dyspnea. C. Avoid all physical activity. D. Lift 20 pounds daily. Answer: B. Walk 100 feet with minimal dyspnea. Rationale: walking 100 feet with minimal dyspnea is a realistic goal, improving endurance without overexertion in COPD. Option A, running, is unrealistic due to oxygen demands. Option C promotes deconditioning. Option D, lifting, risks dyspnea and is less feasible. 107. A patient with COPD is prescribed tiotropium. What should the nurse teach about its use? A. Use it every 2 hours for acute symptoms. B. Inhale it once daily for maintenance. C. Expect sedation as a side effect. D. Stop it if sputum increases. Answer: B. Inhale it once daily for maintenance. Rationale: tiotropium, a long-acting anticholinergic, is used once daily to prevent symptoms, not for acute relief. Option A is incorrect, as it's not a rescue inhaler. Option C is incorrect, as sedation is not a side effect. Option D is incorrect, as increased sputum requires evaluation, not stopping medication. 108. A patient with COPD reports feeling socially isolated. What is the nurse's best intervention? A. Suggest limiting family visits. B. Encourage joining a COPD support group. C. Recommend avoiding public places. D. Advise stopping pulmonary rehabilitation. Answer: B. Encourage joining a COPD support group. Rationale: a COPD support group provides social connection and shared experiences, reducing isolation. Option A worsens isolation. Option C is unnecessary unless infection risk is high. Option D is incorrect as rehabilitation improves physical and emotional health. 109. The nurse is assessing a patient with COPD for signs of respiratory distress. Which finding is most alarming? A. Use of accessory muscles. B. Sputum production of 1 tablespoon. C. Heart rate of 82 beats per minute. D. Oxygen saturation of 91%. Answer. A. Use of accessory muscles. Rationale. Accessory muscle use indicates significant respiratory distress as the patient struggles to breathe against obstruction. Option B, sputum, is common and less urgent. Option C, heart rate, is normal. Option D, 91% saturation, is within COPD target range. 110. A patient with COPD asks why oxygen is set at a low flow rate. What is the nurse's best response? A. High flow can worsen your CO2 retention. B. Low flow saves oxygen for later use. C. It prevents your lungs from drying out. D. High flow causes low blood pressure. Answer. A. High flow can worsen your CO2 retention. Rationale. In COPD, high oxygen flow can suppress respiratory drive, leading to CO2 retention, so low flow, e.g., 1 to 2 liters, is used. Option B is incorrect as conservation isn't the reason. Option C is incorrect as humidifiers prevent drying. Option D is unrelated to oxygen flow. 111. A patient with COPD is prescribed budesonide. What should the nurse monitor for? A. Hypokalemia. B. Hoarseness or sore throat. C. Bradycardia. D. Weight gain. Answer. B. Hoarseness or sore throat. Rationale. Budesonide, an inhaled corticosteroid, can cause hoarseness or sore throat due to local irritation, requiring monitoring. Option A, hypokalemia, is unrelated. Option C, bradycardia, is not a side effect. Option D, weight gain, is more common with oral corticosteroids. 112. The nurse is assisting a patient with COPD in planning daily activities. Which strategy is most effective? A. Complete all tasks without breaks. B. Pace activities with rest periods. C. Schedule exercise only at night. D. Avoid using assistive devices. Answer. B. Pace activities with rest periods. Rationale. Pacing with rest periods conserves energy, reducing dyspnea and fatigue in COPD patients. Option A leads to exhaustion. Option C limits flexibility and may disrupt sleep. Option D is incorrect as devices like walkers reduce energy expenditure. 113. A patient with COPD reports a productive cough. What should the nurse assess first? A. Sputum color and consistency. B. Recent meal intake. C. Blood pressure. D. Skin temperature. Answer. A. Sputum color and consistency. Rationale. Sputum color and consistency indicate infection, e.g., yellow-green suggests bacteria, guiding intervention in COPD. Option B, meals, is unrelated to cough. Option C, blood pressure, is secondary. Option D, skin temperature, may indicate fever but is less specific than sputum. 114. Which statement by a patient with COPD indicates understanding of infection prevention? A. I'll avoid my pneumococcal vaccine. B. I'll clean my nebulizer equipment daily. C. I'll stop my inhalers during a cold. D. I'll visit friends when they're sick. Answer. B. I'll clean my nebulizer equipment daily. Rationale. Daily cleaning of nebulizer equipment prevents bacterial growth, reducing infection risk. Option A is incorrect as vaccines are critical. Option C is incorrect as inhalers should continue. Option D increases infection exposure. 115. A patient with COPD is hypoxic despite oxygen at 2 liters per minute. What should the nurse do next? A. Increase oxygen to 6 liters per minute. B. Notify the healthcare provider. C. Encourage rapid breathing. D. Remove the oxygen cannula. Answer. B. Notify the healthcare provider. Rationale. Persistent hypoxia requires medical evaluation to adjust oxygen or other therapies safely, avoiding CO2 retention. Option A is unsafe without orders. Option C may worsen dyspnea. Option D risks worsening hypoxemia. 116. A patient with advanced COPD discusses fears about dying. What is the nurse's best response? A. Let's focus on your treatment instead. B. Can you share what's worrying you? C. You're not at that point yet. D. Everyone feels scared sometimes. Answer. B. Can you share what's worrying you? Rationale. Inviting the patient to express fears fosters emotional support and identifies needs for palliative care, respecting their concerns. Option A avoids the issue. Option C dismisses the fear. Option D minimizes the patient's unique experience. 117. The nurse is teaching a patient with COPD about oxygen safety. Which instruction is most important? A. Store oxygen tanks in a hot room. B. Avoid using electrical appliances near oxygen. C. Use oxygen only during meals. D. Keep tanks near an open flame. Answer. B. Avoid using electrical appliances near oxygen. Rationale. Electrical appliances can spark, posing a fire risk near oxygen, a flammable gas, making this a critical safety instruction. Option A is unsafe due to heat. Option C is incorrect as oxygen use follows a prescription. Option D is dangerous due to fire risk. 118. A patient with COPD is prescribed Montelukast. What should the nurse teach the patient to report? A. Improved breathing. B. Mood changes or anxiety. C. Increased appetite. D. Weight gain. Answer. B. Mood changes or anxiety. Rationale. Montelukast, a leukotriene modifier, can cause neuropsychiatric side effects like mood changes or anxiety, which should be reported. Option A is a desired effect. Option C is not a common side effect. Option D is less likely with Montelukast. 119. Which finding in a patient with COPD suggests dehydration? A. Moist skin and good turgor. B. Increased sputum production. C. Dry mucous membranes. D. Oxygen saturation of 90%. Answer. C. Dry mucous membranes. Rationale. Dry mucous membranes indicate dehydration, which can thicken mucus and worsen COPD symptoms. Option A suggests hydration. Option B is unrelated to hydration status. Option D is within normal range and not indicative of dehydration. 120. The nurse is evaluating a patient with COPD after teaching about medication adherence. Which statement indicates understanding? A. I'll stop my inhaler if I feel better. B. I'll use my inhaler as prescribed daily. C. I'll take extra doses when I'm short of breath. D. I'll store my inhaler in the bathroom. Answer. B. I'll use my inhaler as prescribed daily. Rationale. Using inhalers as prescribed ensures consistent symptom control, reflecting adherence. Option A risks exacerbation. Option C may lead to overdose. Option D is incorrect as humidity can degrade inhalers. 121. A nurse is assessing a patient with COPD. Which finding indicates a need for immediate intervention? A. Oxygen saturation of 87%. B. Respiratory rate of 32 breaths per minute. C. Clear sputum production. D. Blood pressure of 128/78 mmHg. Answer. B. Respiratory rate of 32 breaths per minute. Rationale. A respiratory rate of 32 breaths per minute indicates tachypnea, a sign of respiratory distress in COPD that requires immediate intervention to address potential hypoxemia or exacerbation. Option A, 87% saturation, is slightly below the COPD target, 88 to 92%, but less urgent than tachypnea. Option C, clear sputum, is typical and not alarming. Option D, blood pressure, is normal. 122. A patient with COPD is prescribed ipratropium via inhaler. What should the nurse teach the patient about its purpose? A. It provides immediate relief for acute dyspnea. B. It prevents bronchospasm with regular use. C. It reduces mucus production in the lungs. D. It increases oxygen saturation directly. Answer: B. It prevents bronchospasm with regular use. Rationale: ipratropium, a short-acting anticholinergic, is used regularly to prevent bronchospasm by relaxing airways. Option A is incorrect as it's not a rescue inhaler, e.g., albuterol is. Option C is incorrect as it doesn't reduce mucus. Option D is incorrect as it improves airflow, not oxygen saturation directly. 123. The nurse is caring for a patient with COPD who reports chest pain during breathing. What should the nurse assess first? A. Recent meal intake. B. Respiratory status and oxygen saturation. C. Blood glucose levels. D. Skin integrity. Answer: B. Respiratory status and oxygen saturation. Rationale: chest pain during breathing in COPD may indicate exacerbation, pneumothorax, or infection, so assessing respiratory status and oxygen saturation is the priority. Option A, meal intake, is unrelated. Option C, glucose, is not relevant. Option D, skin integrity, is secondary to respiratory concerns. 124. A patient with COPD asks why they need to stay hydrated. What is the nurse's best response? A. It helps thin mucus for easier clearance. B. It increases your lung capacity. C. It prevents weight loss. D. It reduces your need for oxygen. Answer: A. It helps thin mucus for easier clearance. Rationale: adequate hydration thins mucus, aiding clearance and reducing airway obstruction in COPD. Option B is incorrect as hydration doesn't affect lung capacity. Option C is unrelated to hydration's primary role. Option D is incorrect as oxygen needs depend on disease severity, not hydration. 125. A patient with COPD is receiving non-invasive ventilation, BiPAP. What is the nurse's priority action? A. Encourage eating during BiPAP use. B. Monitor for skin breakdown around the mask. C. Reduce oxygen concentration. D. Administer a sedative to ensure compliance. Answer: B. Monitor for skin breakdown around the mask. Rationale: BiPAP masks can cause pressure injuries, so monitoring skin integrity is critical to prevent complications. Option A, eating, risks aspiration. Option C, reducing oxygen, is unsafe without orders. Option D, sedative, is dangerous as it may suppress respiratory drive. 126. The nurse is planning care for a patient with COPD. Which goal is most appropriate for sleep quality? A. Sleep 10 hours without waking. B. Reduce nighttime awakenings due to dyspnea. C. Avoid all sleep aids permanently. D. Sleep in a supine position. Answer: B. Reduce nighttime awakenings due to dyspnea. Rationale: reducing awakenings due to dyspnea improves sleep quality, addressing a common COPD issue caused by nocturnal hypoxemia. Option A, 10 hours, is unrealistic. Option C is overly restrictive, as sleep aids may be used cautiously. Option D worsens dyspnea by limiting lung expansion. 127. A patient with COPD is prescribed a combination inhaler with formoterol and budesonide. What should the nurse teach the patient to do? A. Use it as a rescue inhaler for acute symptoms. B. Rinse the mouth after each use. C. Take it only during exacerbations. D. Stop it if heart rate decreases. Answer: B. Rinse the mouth after each use. Rationale: budesonide, a corticosteroid, requires mouth rinsing to prevent oral thrush. Option A is incorrect as this is a maintenance inhaler, not for rescue. Option C is incorrect as it's used daily. Option D is incorrect as formoterol may increase heart rate, but stopping requires medical advice. 128. A patient with COPD feels hopeless about their condition. What is the nurse's best response? A. You're doing better than most patients. B. Let's talk about what's making you feel this way. C. Just focus on taking your medications. D. Things will get better soon, don't worry. Answer: B. Let's talk about what's making you feel this way. Rationale: exploring feelings of hopelessness promotes emotional support and identifies needs for counseling or intervention. Option A minimizes the patient's emotions. Option C ignores psychological needs. Option D offers false reassurance without addressing the issue. 129. The nurse is assessing a patient with COPD for signs of COR pulmonale. Which finding is most indicative? A. Peripheral edema and weight gain. B. Increased sputum production. C. Oxygen saturation of 90%. D. Wheezing on inspiration. Answer: A. Peripheral edema and weight gain. Rationale: peripheral edema and weight gain suggest right-sided heart failure, COR pulmonale, due to increased pulmonary pressure in COPD. Option B, sputum, is common but not specific. Option C, 90% saturation, is normal for COPD. Option D, wheezing, indicates airway obstruction, not heart failure. 130. A patient with COPD asks about using a humidifier at home. What is the nurse's best response? A. It can help keep your mucus thinner. B. It's only useful during summer months. C. It will increase your oxygen needs. D. Avoid it to prevent infections. Answer: A. It can help keep your mucus thinner. Rationale: a humidifier adds moisture to air, thinning mucus and aiding clearance in COPD. Option B is incorrect, as it's useful year-round. Option C is incorrect, as it doesn't affect oxygen requirements. Option D is incorrect if the humidifier is cleaned properly to prevent bacterial growth. 131. A patient with COPD is prescribed salmeterol. What should the nurse monitor for? A. Tremors or nervousness. B. Weight loss. C. Hypoglycemia. D. Skin rash. Answer: A. Tremors or nervousness. Rationale: salmeterol, a long-acting beta agonist, can cause tremors or nervousness due to its stimulant effects. Option B, weight loss, is not a common side effect. Option C, hypoglycemia, is unrelated. Option D, skin rash, is less likely than with other medications. 132. The nurse is assisting a patient with COPD in pulmonary rehabilitation. Which activity is most appropriate to start with? A. High-intensity cycling. B. Slow walking on a flat surface. C. Heavy resistance training. D. Sprinting intervals. Answer: B. Slow walking on a flat surface. Rationale: slow walking is a low-intensity exercise that builds endurance safely for COPD patients, minimizing dyspnea. Option A, cycling, may be too intense initially. Option C, resistance training, is advanced. Option D, sprinting, risks respiratory distress. 133. A patient with COPD reports a change in sputum color to green. What is the nurse's priority action? A. Encourage fluid restriction. B. Notify the healthcare provider. C. Administer a diuretic. D. Increase oxygen flow rate. Answer: B. Notify the healthcare provider. Rationale: green sputum suggests a bacterial infection, a potential exacerbation trigger, requiring medical evaluation for antibiotics or other therapies. Option A, fluid restriction, thickens mucus. Option C, diuretic, is irrelevant. Option D is unsafe, without assessing oxygenation needs. 134. Which statement by a patient with COPD indicates understanding of environmental trigger avoidance? A. I'll keep my windows open for fresh air. B. I'll vacuum regularly to reduce dust. C. I'll burn incense to relax. D. I'll use strong cleaning sprays weekly. Answer: B. I'll vacuum regularly to reduce dust. Rationale: vacuuming reduces dust, an irritant that can trigger COPD symptoms. Option A may introduce pollutants. Option C, incense, produces smoke, worsening symptoms. Option D, cleaning sprays, contains chemicals that irritate airways. 135. The nurse is assessing a patient with COPD for signs of chronic hypoxemia. Which finding is most indicative? A. Hematocrit of 52%. B. Respiratory rate of 18 breaths per minute. C. Pale mucous membranes. D. Blood pressure of 132/84 mmHg. Answer: A. Hematocrit of 52%. Rationale: elevated hematocrit e.g., 52%, indicates polycythemia, a response to chronic hypoxemia in COPD to increase oxygen carrying capacity. Option B, respiratory rate, is normal. Option C, pale membranes, suggests anemia, not hypoxemia. Option D, blood pressure, is normal and unrelated. 136. A patient with advanced COPD asks about palliative care benefits. What is the nurse's best response? A. It's the same as curative treatment. B. It helps manage symptoms to improve comfort. C. It's only for patients in the hospital. D. It stops all medical treatments. Answer. B. It helps manage symptoms to improve comfort. Rationale. Palliative care focuses on symptom relief and quality of life in serious illnesses like COPD, complementing other treatments. Option A is incorrect, as it's not curative. Option C is incorrect, as it's available in various settings. Option D is incorrect, as treatments continue for comfort. 137. The nurse is teaching a patient with COPD about oxygen tank safety. Which instruction is most critical? A. Store tanks lying flat on the floor. B. Keep tanks away from heat sources. C. Use oxygen only during sleep. D. Cover tanks with heavy blankets. Answer. B. Keep tanks away from heat sources. Rationale. Heat sources can cause oxygen tanks to explode, making this a critical safety instruction. Option A is incorrect, as tanks should be upright and secured. Option C is incorrect, as oxygen use follows a prescription. Option D is unsafe, as it may trap heat or obstruct access. 138. A patient with COPD is prescribed theophylline. What should the nurse teach the patient to report? A. Improved energy levels. B. Nausea or rapid heartbeat. C. Increased sputum production. D. Better appetite. Answer. B. Nausea or rapid heartbeat. Rationale. Theophylline has a narrow therapeutic range, and nausea or rapid heartbeat indicate potential toxicity, requiring prompt reporting. Option A, energy, is a positive effect. Option C, sputum, is expected in COPD. Option D, appetite, is not a concerning side effect. 139. Which position should the nurse place a patient with COPD experiencing acute dyspnea? A. Supine with head flat. B. Sitting upright with arms supported. C. Lying on the right side. D. Prone with knees bent. Answer. B. Sitting upright with arms supported. Rationale. Sitting upright with arms supported, tripod position, maximizes lung expansion and reduces breathing effort in acute dyspnea. Option A restricts diaphragm movement. Option C limits chest expansion. Option D is impractical and may worsen breathing. 140. The nurse is evaluating a patient with COPD after teaching about infection prevention. Which action indicates understanding? A. Avoiding hand washing to save time. B. Getting an annual flu vaccine. C. Visiting crowded places during flu season. D. Stopping nebulizer cleaning. Answer. B. Getting an annual flu vaccine. Rationale. An annual flu vaccine reduces the risk of influenza, a common exacerbation trigger, showing understanding. Option A increases infection risk. Option C exposes the patient to viruses. Option D risks bacterial growth in equipment. 141. A nurse is assessing a patient with COPD. Which finding suggests an acute respiratory infection? A. White sputum production. B. Fever and chills. C. Oxygen saturation of 90%. D. Chronic barrel chest. Answer. B. Fever and chills. Rationale. Fever and chills indicate a possible respiratory infection, a common trigger for COPD exacerbations. Option A, white sputum, is normal in stable COPD and less suggestive of infection than colored sputum. Option C, 90% saturation, is within the COPD target range. Option D, barrel chest, is a chronic finding, not acute. 142. A patient with COPD is prescribed a short-acting bronchodilator. What should the nurse teach the patient about its use? A. Use it daily to prevent symptoms. B. Use it as needed for acute dyspnea. C. Take it with meals to reduce side effects. D. Stop it if sputum production increases. Answer: B. Use it as needed for acute dyspnea. Rationale: short-acting bronchodilators, e.g., albuterol, are rescue medications used as needed for acute dyspnea. Option A is incorrect, as long-acting bronchodilators are for prevention. Option C is incorrect, as they're not taken with meals. Option D is incorrect, as increased sputum requires evaluation, not stopping the medication. 143. The nurse is caring for a patient with COPD who reports difficulty breathing at night. What should the nurse assess first? A. Recent caffeine intake. B. Oxygen saturation level. C. Room temperature. D. Blood pressure. Answer: B. Oxygen saturation level. Rationale: difficulty breathing at night in COPD is often due to nocturnal hypoxemia, so assessing oxygen saturation is the priority. Option A, caffeine, may contribute but is secondary. Option C, temperature, is less relevant. Option D, blood pressure, is not directly related to nighttime dyspnea. 144. A patient with COPD asks how to conserve energy during daily tasks. What is the nurse's best response? A. Do all tasks quickly to save time. B. Use a shower chair while bathing. C. Avoid using assistive devices. D. Schedule activities only at night. Answer: B. Use a shower chair while bathing. Rationale: a shower chair reduces energy expenditure during bathing, a high-effort task for COPD patients, minimizing dyspnea. Option A, quick tasks, increases fatigue. Option C is incorrect, as assistive devices conserve energy. Option D limits flexibility and may disrupt sleep. 145. A patient with COPD has a PaCO2 of 70 millimeters of mercury. What is the nurse's priority action? A. Administer oxygen at 6 liters per minute. B. Notify the healthcare provider immediately. C. Encourage deep breathing exercises. D. Place the patient in a supine position. Answer: B. Notify the healthcare provider immediately. Rationale: a PaCO2 of 70 millimeters of mercury indicates severe hypercapnia, suggesting respiratory failure that requires urgent medical intervention, e.g., BiPAP. Option A is unsafe, as high oxygen may worsen CO2 retention. Option C is ineffective in severe cases. Option D restricts breathing. 146. The nurse is planning care for a patient with COPD. Which nutritional goal is most appropriate? A. Consume 3,000 calories daily. B. Achieve adequate protein intake. C. Limit all carbohydrates. D. Restrict fluids to 1 liter daily. Answer: B. Achieve adequate protein intake. Rationale: adequate protein supports respiratory muscle strength and immune function in COPD patients who are at risk for muscle wasting. Option A, 3,000 calories, may be excessive. Option C is incorrect, as balanced carbohydrates provide energy. Option D thickens mucus, hindering clearance. 147. A patient with COPD is prescribed fluticasone. What should the nurse teach the patient to monitor for? A. Increased heart rate. B. Signs of oral candidiasis. C. Weight loss. D. Hypoglycemia. Answer: B. Signs of oral candidiasis. Rationale: fluticasone, an inhaled corticosteroid, can cause oral candidiasis, requiring monitoring and mouth rinsing. Option A, heart rate, is unrelated. Option C, weight loss, is not a common side effect of inhaled forms. Option D, hypoglycemia, is not associated. 148. A patient with COPD expresses guilt about past smoking. What is the nurse's best response? A. You can't change the past, so don't worry. B. Let's focus on what you can do now. C. Smoking doesn't cause COPD for everyone. D. Guilt won't help your condition. Answer: B. Let's focus on what you can do now. Rationale: redirecting to positive actions, e.g., symptom management, quitting, supports the patient emotionally and encourages self-care. Option A dismisses feelings. Option C is misleading, as smoking is the primary cause. Option D is judgmental and unhelpful. 149. The nurse is assessing a patient with COPD for signs of hypoxemia. Which finding is most concerning? A. Oxygen saturation of 88%. B. Restlessness and confusion. C. Respiratory rate of 20 breaths per minute. D. Clear lung sounds. Answer: B. Restlessness and confusion. Rationale: restlessness and confusion indicate severe hypoxemia affecting brain function, requiring immediate intervention. Option A, 88% saturation, is borderline acceptable in COPD. Option C, respiratory rate, is mildly elevated but less urgent. Option D, clear lung sounds, is not specific to hypoxemia. 150. A patient with COPD asks why they need a low oxygen flow rate. What is the nurse's best response? A. It prevents damage to your lungs. B. It avoids suppressing your breathing drive. C. It saves oxygen for other patients. D. It reduces your heart rate. Answer: B. It avoids suppressing your breathing drive. Rationale: low oxygen flow, e.g., 1 to 2 liters, prevents suppression of the hypoxic respiratory drive in COPD patients, avoiding CO2 retention. Option A is incorrect as low flow doesn't directly protect lungs. Option C is irrelevant. Option D is incorrect as oxygen doesn't primarily affect heart rate. 151. A patient with COPD is prescribed a combination inhaler with tiotropium and olodaterol. What should the nurse teach the patient? A. Use it only during acute dyspnea. B. Inhale it once daily as prescribed. C. Expect immediate mucus clearance. D. Stop it if you feel drowsy. Answer: B. Inhale it once daily as prescribed. Rationale: tiotropium and olodaterol are long-acting bronchodilators used once daily for maintenance, not acute relief. Option A is incorrect as it's not a rescue inhaler. Option C is incorrect as it doesn't clear mucus. Option D is incorrect as drowsiness is not a typical side effect requiring cessation. 152. The nurse is assisting a patient with COPD in pulmonary rehabilitation. Which outcome indicates progress? A. Increased dyspnea during exercise. B. Ability to walk farther with less shortness of breath. C. Avoiding all physical activity. D. Needing more oxygen during rest. Answer: B. Ability to walk farther with less shortness of breath. Rationale: walking farther with less dyspnea indicates improved endurance and respiratory efficiency, a key rehabilitation goal. Option A suggests worsening. Option C hinders progress. Option D indicates deconditioning or disease progression. 153. A patient with COPD reports weight gain and swelling in the legs. What should the nurse suspect? A. Improved nutritional status. B. Right-sided heart failure. C. Allergic reaction to medication. D. Excessive carbohydrate intake. Answer: B. Right-sided heart failure. Rationale: weight gain and leg swelling suggest COR pulmonale, right-sided heart failure, due to chronic lung disease in COPD. Option A is unlikely without dietary changes. Option C, allergy, typically causes rash or breathing issues. Option D doesn't cause edema. 154. Which statement by a patient with COPD indicates a need for further teaching about trigger avoidance? A. I'll avoid painting my house myself. B. I'll use my air purifier regularly. C. I'll keep smoking outside only. D. I'll wear a mask in dusty areas. Answer: C. I'll keep smoking outside only. Rationale: smoking, even outside, worsens COPD and triggers exacerbations, indicating a need for further teaching. Options A, B, and D are correct. Avoiding paint fumes, using air purifiers, and wearing masks reduce irritant exposure. 155. The nurse is assessing a patient with COPD for signs of polycythemia. Which laboratory result is most indicative? A. Hemoglobin of 17G/DL. B. White blood cell count of 7,000/mm superscript 3. C. Sodium of 140 milliequivalent/L. D. Platelet count of 250 0.000/mm superscript 3. Answer: A. Hemoglobin of 17G/dl. Rationale: elevated hemoglobin, e.g., 17G/dl, indicates polycythemia, a response to chronic hypoxemia in COPD to enhance oxygen transport. Options B, C, and D are normal and unrelated to polycythemia. 156. A patient with advanced COPD asks about advanced directives. What is the nurse's best response? A. Those are only for terminal patients. B. They let you specify your care preferences. C. You don't need them at this stage. D. Your family will decide for you. Answer: B. They let you specify your care preferences. Rationale: advanced directives allow patients to document care preferences, ensuring their wishes are followed, especially in advanced COPD. Option A is incorrect as they apply to any serious illness. Option C dismisses the patient's initiative. Option D undermines autonomy. 157. The nurse is teaching a patient with COPD about nebulizer use. Which instruction is most important? A. Use it only during the day. B. Clean the equipment after each use. C. Store it in a warm, humid place. D. Share it with family members. Answer: B. Clean the equipment after each use. Rationale: cleaning the nebulizer prevents bacterial growth, reducing infection risk. Option A is incorrect as use follows a prescription. Option C promotes mold growth. Option D is unsafe due to cross-contamination. 158. A patient with COPD is prescribed roflumilast. What should the nurse monitor for? A. Diarrhea or nausea. B. Increased oxygen saturation. C. Elevated blood pressure. D. Improved sleep quality. Answer: A. Diarrhea or nausea. Rationale: roflumilast commonly causes gastrointestinal side effects like diarrhea or nausea, requiring monitoring. Option B is not a direct effect. Option C, blood pressure, is unrelated. Option D, sleep, is not a typical outcome of roflumilast. 159. Which intervention is most effective for a patient with COPD experiencing anxiety-related dyspnea? A. Administer a high-dose bronchodilator. B. Teach guided imagery techniques. C. Increase oxygen to 5 liters per minute. D. Encourage rapid, deep breathing. Answer: B. Teach guided imagery techniques. Rationale: guided imagery reduces anxiety, which can exacerbate dyspnea, without risking respiratory complications. Option A may not address anxiety. Option C is unsafe without orders, risking CO2 retention. Option D worsens dyspnea and anxiety. 160. The nurse is evaluating a patient with COPD after teaching about exacerbation prevention. Which action indicates understanding? A. Stopping inhalers during stable periods. B. Avoiding exposure to strong perfumes. C. Visiting crowded places regularly. D. Skipping the pneumococcal vaccine. Answer: B. Avoiding exposure to strong perfumes. Rationale: avoiding strong perfumes prevents airway irritation, reducing exacerbation risk, showing understanding. Option A risks symptom recurrence. Option C increases infection risk. Option D is incorrect as vaccines are essential. 161. A nurse is assessing a patient with COPD. Which finding indicates a potential exacerbation? A. Stable respiratory rate of 18 breaths per minute. B. New onset productive cough with purulent sputum. C. Oxygen saturation of 91%. D. Chronic clubbing of fingers. Answer: B. New onset productive cough with purulent sputum. Rationale: a new productive cough with purulent sputum suggests infection, a common trigger for COPD exacerbations. Option A, respiratory rate of 18, is normal. Option C, 91% saturation, is within the COPD target range, 88 to 92%. Option D, clubbing, is a chronic sign, not indicative of acute exacerbation. 162. A patient with COPD is prescribed salbutamol. What should the nurse teach the patient about this medication? A. Take it once daily for maintenance. B. Use it as needed for shortness of breath. C. Expect weight gain as a side effect. D. Stop it if sputum color changes. Answer. B. Use it as needed for shortness of breath. Rationale: salbutamol, albuterol, a short-acting beta agonist, is used as needed for acute dyspnea relief. Option A is incorrect as it's not for maintenance. Long-acting bronchodilators are. Option C is incorrect as weight gain is not a side effect. Option D is incorrect as sputum change requires evaluation, not stopping salbutamol. 163. The nurse is caring for a patient with COPD who reports fatigue after minimal activity. What should the nurse assess first? A. Recent meal timing. B. Oxygen saturation level. C. Blood pressure. D. Sleep duration. Answer. B. Oxygen saturation level. Rationale: fatigue in COPD is often due to hypoxemia, so assessing oxygen saturation is the priority to determine if low oxygen is causing the symptom. Option A, meals, may contribute but is secondary. Option C, blood pressure, is less directly related. Option D, sleep, is relevant but not the first priority. 164. A patient with COPD asks how to reduce mucus buildup. What is the nurse's best response? A. Limit fluid intake to 500 milliliters daily. B. Drink plenty of water to stay hydrated. C. Avoid coughing to save energy. D. Use a dehumidifier at home. Answer. B. Drink plenty of water to stay hydrated. Rationale: hydration thins mucus, making it easier to clear and reducing buildup in COPD. Option A thickens mucus, worsening obstruction. Option C is incorrect as coughing aids clearance. Option D, dehumidifier, may dry airways, hindering mucus mobility. 165. A patient with COPD has a sudden drop in oxygen saturation to 84%. What is the nurse's priority action? A. Encourage pursed lip breathing. B. Notify the healthcare provider. C. Administer oxygen at 10 liters per minute. D. Place the patient in a supine position. Answer. B. Notify the healthcare provider. Rationale: a sudden drop to 84% indicates severe hypoxemia, requiring immediate medical evaluation to adjust oxygen or other therapies safely, avoiding CO2 retention. Option A is insufficient for severe hypoxia. Option C is unsafe without orders due to risk of respiratory depression. Option D worsens breathing. 166. The nurse is planning care for a patient with COPD. Which goal is most appropriate for managing chronic cough? A. Eliminate cough completely. B. Reduce cough frequency and improve comfort. C. Increase sputum production. D. Avoid all cough suppressants permanently. Answer. B. Reduce cough frequency and improve comfort. Rationale: reducing cough frequency and improving comfort is realistic, as chronic cough in COPD is persistent but can be managed with hydration and medications. Option A is unachievable. Option C is undesirable as excessive sputum complicates breathing. Option D is overly restrictive, as suppressants may be used cautiously. 167. A patient with COPD is prescribed budesonide/formoterol. What should the nurse teach the patient to do after inhalation? A. Exhale forcefully to clear lungs. B. Rinse the mouth with water. C. Take a second dose immediately. D. Lie down to rest. Answer. B. Rinse the mouth with water. Rationale: budesonide, a corticosteroid, requires mouth rinsing to prevent oral candidiasis. Option A expels medication, reducing efficacy. Option C is incorrect as dosing follows a schedule. Option D is unrelated to inhaler use and may worsen dyspnea. 168. A patient with COPD feels overwhelmed by their diagnosis. What is the nurse's best response? A. It's normal to feel this way. Let's discuss your concerns. B. You'll get used to it over time. C. Focus on your medications instead. D. Others have it worse, so stay positive. Answer. A. It's normal to feel this way. Let's discuss your concerns. Rationale: acknowledging feelings and encouraging discussion provides emotional support and identifies coping needs. Option B dismisses the patient's emotions. Option C ignores psychological needs. Option D minimizes the patient's experience, discouraging expression. 169. The nurse is assessing a patient with COPD for signs of right-sided heart failure. Which finding is most indicative? A. Dry, non-productive cough. B. Ascites and hepatomegaly. C. Oxygen saturation of 89%. D. Respiratory rate of 20 breaths per minute. Answer: B. Ascites and hepatomegaly. Rationale: ascites and hepatomegaly indicate right-sided heart failure, cor pulmonale, from increased pulmonary pressure in COPD. Option A, dry cough, is less common in COPD. Option C, 89% saturation, is normal for COPD. Option D, respiratory rate, is mildly elevated but not specific. 170. A patient with COPD asks about using a fan to ease breathing. What is the nurse's best response? A. A fan can help you feel less short of breath. B. Fans increase your oxygen needs. C. Avoid fans to prevent infections. D. Use a fan only at night. Answer: A. A fan can help you feel less short of breath. Rationale: a fan's airflow can reduce the sensation of dyspnea by stimulating facial nerves, aiding comfort in COPD. Option B is incorrect, as fans don't affect oxygen requirements. Option C is incorrect, as fans don't inherently cause infections. Option D is unnecessary, as fans can be used anytime. 171. A patient with COPD is prescribed ipratropium. What should the nurse monitor for? A. Dry mouth or constipation. B. Weight gain. C. Hypokalemia. D. Skin discoloration. Answer: A. Dry mouth or constipation. Rationale: ipratropium, an anticholinergic, can cause dry mouth or constipation due to its drying effects. Option B, weight gain, is not a side effect. Option C, hypokalemia, is unrelated. Option D, skin discoloration, is not associated. 172. The nurse is helping a patient with COPD plan meals. Which recommendation is most appropriate? A. Eat one large meal daily to save energy. B. Choose small, frequent meals to avoid fullness. C. Avoid all dairy products permanently. D. Restrict protein to reduce digestion effort. Answer: B. Choose small, frequent meals to avoid fullness. Rationale: small, frequent meals prevent gastric distension, reducing pressure on the diaphragm and easing breathing. Option A worsens dyspnea. Option C is unnecessary unless lactose intolerant. Option D is incorrect, as protein supports respiratory muscles. 173. A patient with COPD reports a new fever and increased dyspnea. What should the nurse do first? A. Administer a fever-reducing medication. B. Assess respiratory status and vital signs. C. Encourage fluid restriction. D. Increase oxygen flow to 5 liters per minute. Answer: B. Assess respiratory status and vital signs. Rationale: fever and increased dyspnea suggest exacerbation or infection, so assessing respiratory status and vital signs determines severity and guides intervention. Option A requires a prescription. Option C may thicken mucus. Option D is unsafe without orders due to CO2 retention risk. 174. Which statement by a patient with COPD indicates understanding of activity planning? A. I'll do all my chores in one session. B. I'll rest between tasks to avoid getting tired. C. I'll exercise only when I feel energetic. D. I'll avoid using a walker to stay strong. Answer: B. I'll rest between tasks to avoid getting tired. Rationale: resting between tasks conserves energy, reducing dyspnea and fatigue, showing understanding. Option A leads to exhaustion. Option C limits consistency. Option D is incorrect, as walkers reduce energy expenditure. 175. The nurse is assessing a patient with COPD for chronic hypercapnia. Which finding is most indicative? A. Oxygen saturation of 90%. B. Morning headaches and drowsiness. C. Heart rate of 80 beats per minute. D. Clear lung sounds. Answer: B. Morning headaches and drowsiness. Rationale: morning headaches and drowsiness suggest chronic hypercapnia, as CO2 retention causes cerebral vasodilation and neurological effects. Option A, 90% saturation, is normal. Option C, heart rate is normal. Option D, clear lung sounds, is not typical in COPD and unrelated to hypercapnia. 176. A patient with advanced COPD asks about the benefits of hospice care. What is the nurse's best response? A. It focuses on comfort and quality of life. B. It's only for patients with weeks to live. C. It replaces all your current treatments. D. It's not suitable for COPD patients. Answer: A. It focuses on comfort and quality of life. Rationale: hospice care prioritizes comfort and quality of life for terminal conditions like advanced COPD. Option B is incorrect, as eligibility depends on prognosis, not fixed time. Option C is incorrect, as treatments continue for symptom relief. Option D is incorrect, as COPD qualifies for hospice. 177. The nurse is teaching a patient with COPD about oxygen safety. Which instruction is most critical? A. Use oxygen only during activity. B. Avoid open flames near oxygen equipment. C. Store oxygen tanks in a small closet. D. Turn off oxygen during showers. Answer: B. Avoid open flames near oxygen equipment. Rationale: oxygen is highly flammable, and open flames pose a severe fire risk, making this the most critical instruction. Option A is incorrect, as oxygen use follows a prescription. Option C is unsafe due to poor ventilation. Option D risks hypoxemia unless prescribed. 178. A patient with COPD is prescribed a mucolytic agent. What should the nurse teach the patient to expect? A. Immediate bronchodilation. B. Easier mucus clearance. C. Reduced oxygen needs. D. Increased respiratory rate. Answer: B. Easier mucus clearance. Rationale: mucolytics, e.g., acetylcysteine, thin mucus, facilitating clearance in COPD. Option A is incorrect, as mucolytics don't dilate airways. Option C is not a direct effect. Option D is undesirable and unrelated to mucolytics. 179. Which intervention is most effective for a patient with COPD experiencing dyspnea during meals? A. Eat large portions to finish quickly. B. Take small bites and rest between. C. Lie down immediately after eating. D. Avoid drinking fluids with meals. Answer: B. Take small bites and rest between. Rationale: small bites with rest periods reduce energy expenditure and gastric distension, easing dyspnea during meals. Option A worsens breathing. Option C restricts lung expansion. Option D may thicken mucus, hindering clearance. 180. The nurse is evaluating a patient with COPD after teaching about medication use. Which action indicates understanding? A. Using a bronchodilator before a corticosteroid inhaler. B. Skipping doses when feeling well. C. Storing inhalers in a humid bathroom. D. Taking extra doses without consulting a provider. Answer: A. Using a bronchodilator before a corticosteroid inhaler. Rationale: using a bronchodilator first opens airways, enhancing corticosteroid delivery, showing correct technique. Option B risks exacerbations. Option C degrades inhalers. Option D may cause overdose. 181. A nurse is assessing a patient with COPD. Which finding suggests worsening airflow obstruction? A. Oxygen saturation of 90%. B. Increased expiratory wheezing. C. Heart rate of 78 beats per minute. D. Clear sputum production. Answer: B. Increased expiratory wheezing. Rationale: increased expiratory wheezing indicates narrowing airways and worsening airflow obstruction, common in COPD exacerbations. Option A, 90% saturation, is within the target range for COPD. Option C, Heart rate of 78 is normal. Option D, clear sputum, is typical and not indicative of obstruction. 182. A patient with COPD is prescribed tiotropium. What should the nurse teach the patient about its administration? A. Use it every 4 hours for acute symptoms. B. Inhale it once daily using a dry powder inhaler. C. Take it with food to reduce side effects. D. Expect immediate relief after use. Answer. B. Inhale it once daily using a dry powder inhaler. Rationale. Tiotropium is a long-acting anticholinergic used once daily via a dry powder inhaler for maintenance therapy. Option A is incorrect, as it's not for acute relief. Option C is incorrect, as it's not taken orally. Option D is incorrect, as its effects build over time, not immediately. 183. The nurse is caring for a patient with COPD who reports waking up short of breath. What should the nurse assess first? A. Recent medication doses. B. Oxygen saturation and respiratory effort. C. Blood glucose levels. D. Room humidity levels. Answer. B. Oxygen saturation and respiratory effort. Rationale. Waking up short of breath suggests nocturnal hypoxemia or exacerbation, so assessing oxygen saturation and respiratory effort is the priority. Option A, medications, is secondary. Option C, glucose, is unrelated. Option D, humidity, may contribute but is less urgent. 184. A patient with COPD asks how to manage dry mouth from inhalers. What is the nurse's best response? A. Reduce water intake to avoid fluid overload. B. Sip water or use sugar-free gum frequently. C. Stop using the inhaler temporarily. D. Brush teeth only once daily. Answer. B. Sip water or use sugar-free gum frequently. Rationale. Sipping water or using sugar-free gum relieves dry mouth, a side effect of anticholinergic inhalers, without affecting treatment. Option A worsens dryness. Option C risks symptom recurrence. Option D is unrelated and inadequate for dry mouth. 185. A patient with COPD has a respiratory rate of 30 breaths per minute and confusion. What is the nurse's priority action? A. Encourage fluid intake. B. Notify the healthcare provider immediately. C. Administer oxygen at 8 liters per minute. D. Teach relaxation techniques. Answer. B. Notify the healthcare provider immediately. Rationale. Tachypnea, 30 breaths per minute, and confusion suggest severe hypoxemia or hypercapnia, requiring urgent medical evaluation. Option A, fluids, is irrelevant to acute distress. Option C is unsafe without orders due to CO2 retention risk. Option D is ineffective in severe cases. 186. The nurse is planning care for a patient with COPD. Which goal is most appropriate for managing anxiety? A. Eliminate all anxious feelings. B. Reduce anxiety-related dyspnea episodes. C. Avoid all social interactions. D. Increase oxygen flow during anxiety. Answer. B. Reduce anxiety-related dyspnea episodes. Rationale. Reducing anxiety-related dyspnea is realistic, as anxiety exacerbates breathing difficulty in COPD, and techniques like relaxation can help. Option A is unachievable. Option C isolates the patient unnecessarily. Option D requires medical orders and isn't a primary goal. 187. A patient with COPD is prescribed salmeterol/fluticasone. What should the nurse teach the patient to report? A. Improved exercise tolerance. B. White patches in the mouth. C. Increased appetite. D. Better sleep quality. Answer. B. White patches in the mouth. Rationale. White patches indicate oral candidiasis, a side effect of fluticasone corticosteroid, requiring prompt reporting. Options A, C, and D are positive outcomes, not adverse effects needing reporting. 188. A patient with COPD expresses fear of becoming dependent on oxygen. What is the nurse's best response? A. Oxygen is just a temporary measure. B. It helps you breathe easier and stay active. C. You'll get used to it, so don't worry. D. Most patients don't need it long term. Answer. B. It helps you breathe easier and stay active. Rationale. Explaining oxygen's benefits, improved breathing and activity, addresses fear while promoting acceptance. Option A is misleading as oxygen may be long-term. Option C dismisses the concern. Option D is inaccurate for advanced COPD. 189. The nurse is assessing a patient with COPD for signs of dehydration. Which finding is most concerning? A. Moist mucous membranes. B. Concentrated urine and thirst. C. Oxygen saturation of 91%. D. Heart rate of 82 beats per minute. Answer. B. Concentrated urine and thirst. Rationale. Concentrated urine and thirst indicate dehydration, which thickens mucus and worsens COPD symptoms. Option A suggests hydration. Option C, 91% saturation is normal. Option D, heart rate, is normal and not specific to dehydration. 190. A patient with COPD asks why they need a pneumonia vaccine. What is the nurse's best response? A. It prevents all lung infections. B. It reduces your risk of severe pneumonia. C. It eliminates the need for inhalers. D. It increases your lung capacity. Answer. B. It reduces your risk of severe pneumonia. Rationale. The pneumonia vaccine lowers the risk of severe pneumococcal infections, a major exacerbation trigger in COPD. Option A is incorrect as it doesn't prevent all infections. Option C is incorrect as vaccines don't replace inhalers. Option D is incorrect as it doesn't affect lung capacity. 191. A patient with COPD is prescribed a nebulized bronchodilator. What should the nurse teach the patient to do? A. Use it only during exacerbations. B. Breathe slowly and deeply during treatment. C. Stop if heart rate decreases. D. Take it before meals only. Answer. B. Breathe slowly and deeply during treatment. Rationale. Slow, deep breathing ensures optimal delivery of nebulized medication to the lungs. Option A is incorrect as nebulizers may be used regularly. Option C is incorrect as heart rate changes require evaluation, not stopping. Option D is incorrect as timing isn't meal dependent. 192. The nurse is assisting a patient with COPD in pulmonary rehabilitation. Which activity is most appropriate? A. Running 400 meters daily. B. Stationary cycling at a low resistance. C. Lifting heavy weights. D. High-impact aerobics. Answer. B. Stationary cycling at a low resistance. Rationale. Low-resistance stationary cycling builds endurance safely without excessive dyspnea in COPD patients. Options A, C, and D are too intense, risking respiratory distress. 193. A patient with COPD reports a new onset of chest tightness. What should the nurse do first? A. Administer a diuretic immediately. B. Assess respiratory status and vital signs. C. Encourage fluid restriction. D. Increase oxygen flow to 6 liters per minute. Answer. B. Assess respiratory status and vital signs. Rationale. Chest tightness may indicate bronchospasm or exacerbation, so assessing respiratory status and vital signs is the priority to guide intervention. Option A, diuretic, is irrelevant. Option C may worsen mucus clearance. Option D is unsafe without orders due to CO2 retention risk. 194. Which statement by a patient with COPD indicates understanding of exacerbation prevention? A. I'll avoid my flu shot to save time. B. I'll stay away from cigarette smoke. C. I'll use strong air fresheners daily. D. I'll stop my inhalers when I feel better. Answer. B. I'll stay away from cigarette smoke. Rationale. Avoiding cigarette smoke prevents airway irritation and exacerbations, showing understanding. Option A increases infection risk. Option C introduces irritants. Option D risks symptom recurrence. 195. The nurse is assessing a patient with COPD for signs of chronic hypoxemia. Which finding is most indicative? A. Clubbing of the fingers and cyanosis. B. respiratory rate of 18 breaths per minute. C. Blood pressure of 130/80 mmHg. D. Clear lung sounds bilaterally. Answer: A. Clubbing of the fingers and cyanosis. Rationale: clubbing and cyanosis indicate chronic hypoxemia due to prolonged low oxygen levels affecting tissues. Option B, respiratory rate is normal. Option C, blood pressure is normal. Option D, clear lung sounds, is atypical in COPD and unrelated to hypoxemia. 196. A patient with advanced COPD asks about the difference between palliative care and hospice. What is the nurse's best response? A. Palliative care focuses on comfort at any stage, while hospice is for terminal care. B. They're the same. Both stop all treatments. C. Palliative care is only for pain relief. D. Hospice is for earlier stages of COPD. Answer: A. Palliative care focuses on comfort at any stage, while hospice is for terminal care. Rationale: palliative care improves quality of life at any disease stage, while hospice is for patients with a terminal prognosis, e.g., 6 months or less. Option B is incorrect as neither stops all treatments. Option C is incorrect as palliative care addresses multiple symptoms. Option D is incorrect as hospice is for end-stage disease. 197. The nurse is teaching a patient with COPD about oxygen tank maintenance. Which instruction is most important? A. Store tanks in direct sunlight for warmth. B. Check tanks regularly for leaks or damage. C. Use tanks only during sleep hours. D. Cover tanks with cloth to prevent dust. Answer: B. Check tanks regularly for leaks or damage. Rationale: checking for leaks or damage ensures safety, as faulty tanks pose fire or injury risks. Option A is unsafe due to heat exposure. Option C is incorrect as oxygen use follows a prescription. Option D may trap heat or obstruct access. 198. A patient with COPD is prescribed Monteliacast. What should the nurse teach the patient to monitor for? A. Improved mucus clearance. B. Sleep disturbances or vivid dreams. C. Increased oxygen saturation. D. Weight gain. Answer: B. Sleep disturbances or vivid dreams. Rationale: Monteliacast can cause neuropsychiatric side effects like sleep disturbances or vivid dreams, requiring monitoring. Option A is not a primary effect. Option C is not directly related. Option D is uncommon with Monteliacast. 199. Which intervention is most effective for a patient with COPD experiencing dyspnea while dressing? A. Dress quickly to save time. B. Sit and rest between clothing changes. C. Avoid loose clothing to stay warm. D. Hold breath while dressing. Answer: B. Sit and rest between clothing changes. Rationale: sitting and resting between steps conserves energy, reducing dyspnea during dressing. Option A increases effort and dyspnea. Option C is incorrect as loose clothing eases breathing. Option D worsens oxygen deprivation. 200. The nurse is evaluating a patient with COPD after teaching about home safety. Which action indicates understanding? A. Keeping oxygen tanks near the fireplace. B. Installing smoke detectors throughout the home. C. Using candles for lighting near oxygen. D. Storing extra tanks in a hot garage. Answer: B. Installing smoke detectors throughout the home. Rationale: smoke detectors enhance safety by alerting to fires critical in homes with oxygen use, showing understanding. Options A, C, and D are unsafe due to fire risks near oxygen equipment.